All right, we need to, how come, okay, now there it goes. It takes a second for the mic to work. We're going to go back and we're going to start with items 1 and 2. So I think, do we have, is it somebody online or do we have somebody here from the department? Oh, right here. Okay. All right, welcome.
Good afternoon, Chair Dennis, Vice Chair Carlton, members of the Interim Finance Committee. For the record, my name is Craig Satuki. I'm currently serving as the Interim Deputy Superintendent of Educator Effectiveness and Family Engagement for the Department of Education. We're here today to discuss item D1. With me is Christine McGill, who is the Director of the Office of Safe and Respectful Learning Environments, and she'll provide an overview of this request.
And you can give a quick version because we obviously heard this last time. So do a quick version and then we'll get to our questions. Thanks.
Christine McGill, Director of the Office of Safe and Respectful Learning. Good afternoon, Chair Dennis and members of the committee. Very quickly, just since we saw you last time, school has started. Unfortunately, we were hoping to see that the indicators of some of the climate, the hot climate that we saw last year would decrease. We're still seeing those indicators high, so we're seeing high levels of student-to-student violence, bullying, and also suicide ideation. So these funds are still really important. Some of those short-term outcomes that we're hoping to accomplish with these funds is, one, the workforce shortage issues, as you brought up last time. Are we going to be able to spend the ESSER II dollars in the time allotted? And yes, for several reasons. One, because the need is so high, really looking at ways to diversify the workforce into an ecosystem so we have lower level licensures paired with higher level licensures to address the need in each schools. Just to be completely transparent, we do still have some schools without a school counselor or school social worker, and we know that's a big gap, so we're really working on that as well. The other piece of the workforce development piece that we're working on is the districts told us that the short timelines between different grants are difficult to make them competitive. So this ask represents the extension of those timelines so that we can kind of show districts that we have funds lined up for them. We're hoping to go all the way to 2026, and then hopefully that we'll be able to build Medicaid for many of these services, and we'll be able to have some of the services decrease because we're getting out of the pandemic. So that is that short-term strategy as well. The other piece is the last strategy that we've done, actually two more, is looking at collaboration. So not only pairing lower level licensures or community health workers to create that ecosystem, but also to look at who is in our schools now. So we're really looking at protocols of how schools interact with law enforcement and our mobile crisis teams. Thank you to DHHS for being this great partner throughout this pandemic, which has really hit our schools hard. So we're really looking at that because kids have needs right now. So we're really looking at who is in the buildings, how do we all work together and really get some of these needs under control. The other piece is that those lower level will be able to focus on what we call tier 1 or prevention. We have data that shows going back about 4 years to show that when schools focus on prevention and those low-level tiers, we actually reduce the time it takes from administrators to deal with discipline. We reduce discipline incidences, and we also reduce need for Tier 3 services. So that's why the ecosystem of support in our schools is really important, to have those licensed clinical social workers right alongside those community health workers and the bachelor's levels to do the ecosystem of support. And the last thing, a whole lot of gratitude to the district, fiscal people as well as our own NDE fiscal people who really looked at what districts can spend ESSER $2 now and redirect some of those dollars to those districts that can spend now, not forgetting the ones that are having more workforce shortage issues, but to redirect that now and then to look at the ones that are really struggling with the workforce shortage issues, having those funds kind of funnel in as they come in. So we reallocated, we provided a table for you all. We reallocated some of those funds so that we can guarantee the expenditures of ESSER 2 so that we show progress because, again, there's need in all of our districts. So those are the quick updates we have for you from the last time I spoke.
Thank you. So I think you just kind of addressed this, but the reimbursements, how those have gone, do you want to talk with some specifics there?
Sure. Christy McGill for the record. So far, as of October 15th, we have spent down, there's a total of $5,735,000. We have spent down $1,764,000. This month, we talked to the districts. Some of the districts, like Clark County, are having harder time expending these ESSER 2 dollars. Lyon County already spent their money, and so again, so we're going to pull from Clark, short term, and give to Lyon so that we can expend these ESSER 2 dollars and look at other funding for the other districts that are having workforce issues.
So how are they going to resolve those issues?
So our districts that are experiencing workforce shortage issues right now are the ones that are really kind of diving in what I just said, looking at lower level licensures to bring in people to work alongside of their higher licensure. So there is less of a workforce shortage for community health workers and social workers with a bachelor's degree. So we're going to do that, and then also really look at utilizing contracted services. Again, this is very short term, but looking at contracting services, whether it's Invo, Progressus, and other entities like that to help go in, at least temporarily, help kind of get our schools settled and through this mental health pandemic crisis, and then to move forward that way. So those are the two things that have changed since the last time we talked.
Okay, and you're confident in that you're going to expend the full amount?
Yes.
Okay. Other questions? Not seeing any questions. Vice Chair Carlton, you want to make a motion?
Thank you, Mr. Chairman. I would move for approval of items 1 and 2.
We have a motion and a second from Senator Cannizzaro to approve items 1 and 2. Any further discussion on the motion? All in favor say aye. Aye. Any opposed say nay.
Aye.
Motion carries. All right. Let's go to our next one, which is...
So 9 and D9 and J.
So now we're going to do D9 and J.
Good afternoon, Chair Dennis and members of the IFC. I'm Terry Reynolds, Director for the Department of Business and Industry, and with me is Steve Acroft, who is our Administrator for the Nevada Division of Housing. With the Chair's permission, we would like to start with item J, which is the overall status report, and then from there move into item 9. I think that progression would help the understanding and some questions that may occur.
Will it make it go faster?
Yes.
Okay, then yes.
Thank you, Chair Dennis. For the record, Steve Acroft, Administrator of the Nevada Housing Division. To go over the Home Means Nevada initiative, and just to make sure everyone is aware of exactly what this is, and I'll sum it up in 2 sentences. It's a $500 million investment to increase and preserve affordable housing opportunities for Nevadans. The $500 million total, $250 of which is pending your approval today, is split among 4 distinct categories: home ownership, opportunities and rehabilitation, land acquisition, preservation of existing affordable structures, and new development of affordable structures. I'm here to report that we are oversubscribed in all 4 categories. We've gone through a significant application period. the home ownership and rehabilitation category, which is the smallest category, $30 million. We have $96 million in valid requests. Land acquisition, $40 million. We have $80 million in valid requests. Preservation, $130 million of affordable housing, $227 million in requests. And that includes the preservation in total of over 2,000 units, 94 supportive units and transitional units, 1,700 at AMIs, area median incomes, below 50%, and 446 senior units. The new development category, $300 million, we have almost $1 billion in valid requests, $966 million. And the total would represent the creation of over 5,600 new units, 800 supportive or transitional, 3,000 additional to serve the low and extremely low-income Nevadans, and over 1,800 senior units. Now, obviously, not all of those are going to get funded because we've received a total of 103 applications requesting over $1.25 billion in affordable housing development. So effectively, we're oversubscribed 2.5 times. We formed various scoring committees to score the applications. We had a lot of stakeholders from the affordable housing community do this. Things like site amenities, affordability, sustainability, and the financial aspects are currently being under review by Novogradac and Company. For those of you who don't know, they are a national accounting firm, the premier national accounting firm specializing in tax credit properties and affordable properties. So once we determine the preliminary award of fundings, which will be very, very shortly, we'll be working with the governor's finance office, and I can't say enough for them and their participation in this process for final eligibility review, and we'll be stress testing the projects to mitigate the risks associated with the award from both a financial standpoint and an eligibility and compliance standpoint. And this came up a little bit earlier in discussions about other things. Treasury actually has a how-to guide for using SLFRF for affordable housing. So that's come out a couple months ago, extremely helpful in what we're doing. And so that gives you the overview of where we're at currently with the program. Sort of moving on to the additional request, agenda item D9. I'm going to have Mr. Holliday, who is our Chief Financial Officer. He's on Zoom, and he will kind of walk you through the need for the funding at this point.
Good afternoon, Mr. Chair and members of the committee. For the record, Michael Holliday, I am the Chief Financial Officer for the Nevada Housing Division. So the timing request on our part, and I'll just reiterate the deadlines for everyone's recognition again. Funds must be obligated by December 31st of 2024 and fully expended, or the expenses have to be incurred fully by 12/31 of 2026. We're here today to request the approval of the second transfer of funds so that the division then has the authority to provide developers a notice of award funding. The approval and subsequent awards then allow the development teams to move forward with their financial closing and to begin construction so that they have adequate time to meet those spending deadlines as set by the U.S. Treasury. There are a lot of moving pieces on these financing these developments, basically. And once the developers have an award in their hands, they have to still be able to go to their lenders, tax credit investors, contractors, and other partners in good faith, knowing that they have a firm commitment of the Home Means Nevada initiative funds from the state. And I'll give you one example of how the timing of this really affects development. So projects that scored highly in the ranking need to be ready to begin construction as soon as they close on financing. In order to do that, most of them are going to have a purchase and sale agreement with a landowner, for example. And a lot of those are probably going to expire if we push out too far, and then the project basically just has to start over or start from scratch. So that's one example of from a development side, because these are all predominantly real estate transactions, the timing is important. And with that, I'll turn it back to Administrator Acroft.
Terry Reynolds, Director for Business and Industry. I wanted to also mention that for the last 2 years, we have set aside we call volume cap, and that allows us to issue tax-free municipal bonds for industrial revenue bonds or housing projects. And we have set aside in 2 years $565 million worth of volume cap to be able to bond. So we are working with these with the communities. Clark County, they funded several projects, but we will be able to combine and work with our available volume cap to be able to help finance these projects. So we typically can get, for every dollar spent, we can get 2.5 to 3 times as much volume of project out of the dollars that we set aside. So that's very important in realizing this. And having this money to be able to start off and work gives the satisfaction and the confidence for development to go ahead and have their investors get involved in the project and be able to set up the bonding if they need to bond for the project. So that's why this is so important to have it as soon as we can.
And Steve Acroft, for the record, I think with that, we'll be available for questions.
Okay, thank you. We're going to start with Assemblywoman Danielle Monroe Moreno.
Thank you, Mr. Chair. And pardon me, I'm losing my voice. Thank you for the presentation, but also thank you for the work that you all have been doing. I know that I was at the groundbreaking of a facility, and it's almost finished. And we know that there's a huge immediate need, and there's long-term needs when it comes to housing. And that's been demonstrated in your testimony that we're oversubscribed. So there's a lot more need than there are dollars for. So as you do that scoring, how are you going to determine in the scoring who rises to the top to get the funding? What will happen with those that are there that won't get funding? Is there a measure that we can help them going forward? Do you have any idea? And then as the funds are being awarded, when do you see that starting? And what projects are already been started? It's a lot of questions, and I apologize.
No, I appreciate that. Steve Acroft, for the record. All great questions, and to answer the last one first, because that's the one I remember most, we hope to be able to announce preliminary awards next week. And as Mr. Holliday indicated, that will at least start those processes. Scoring, various categories, so the land, the home ownership, and the preservation and new development all had sort of different questions, and in most cases it was like literally 100 and some odd questions specifically on the development. You know, how are you going to do this? What are you going to do? And how are you going to achieve this? And so that was divided up right offhand into about 6 or 7 different scoring categories regarding project narrative, site amenities. There were about 3 or 4 financial categories, the capability of the developer to do it. And there was a whole category set up for sustainability and affordability, population served, things of that ilk. We had a couple of different scoring groups, as I mentioned, community folks do that, and then the Novogradac group is doing the financial aspects of it. Those are tabulated. So as an example, in new development and preservation, there's 150 points through this application process that are available. And whoever, rises to the top, they are going to be considered for funding. We still have to work with them in a lot of regards. We still have to work with them in their ask, because these applications were processed before, not processed, were put out before Clark County issued their CHF funds, which was $120 million of funding. So we know some projects received some funding there. They may have asked for $10 million from us through Home Means Nevada, but they got $5 million, just for sake of easy math, through Home Means Nevada, but they applied for $10 million because they didn't know they were going to get that $5 million to begin with. So we need to go through those and scoring applications that are above, in the new development bucket, above that $300 million threshold, determine that they do in fact need $10 million or whatever that number is, And if they only need $5 million, well, that just freed up $5 million for somebody who might have fallen below that line. So that's sort of the vetting process that we have to go through. So to answer the balance of that question, if we cannot fund projects, and my God, there are so many good projects, and we can't fund them all. We know that. Then we are going to look at that waterfall. That'll be the first. We will look at existing funding that we have, whether it's through tax credits, whether it's through affordable housing trust funds, those type of grants that we have. And then there's a whole nother part of this. There's some affordable housing componentry in, as an example, the Inflation Reduction Act that allows for solar power to be installed and tax credits. So can we get those folks who are doing that to use that? And maybe that, it's not going to free up a lot, but it will free up something. And so we're constantly looking for that and to see how they're leveraging other sources. So I apologize for the long-winded answer, but there you go.
Thank you. No need to apologize. I gave you a long-winded question, so thank you so much for answering. Thank you, Mr. Chair.
Other questions? Yes. Haurigi.
Thank you, Chair. And I just had some quick questions. I know we speak a lot about the preservation and the new development for affordable housing, but just can we touch a little bit on the home ownership program, what that looks like, where the monies or what organizations have applied for the down payment assistance dollars, and is that going through a similar scoring process?
Steve Acroft, for the record, yes, it is. The points available in that particular category are 100. Doesn't affect, they're not competing against the new development, so they're not already at 50% lower than where they should be. But the down payment assist, there's three basic ways we saw applications come through that particular process. One was for down payment assistance, one was for the new construction of affordable homes, and one was for the rehabilitation of homes to allow for seniors to age in place or those who are physically disabled to age. And for that last one, we will be looking at not only our weatherization programs, but also, as I mentioned previously, additional legislation that's come through the bipartisan infrastructure law that allows potentially for some funding to help those folks too. So there's a whole litany of things that we can potentially leverage in that. Organizations that applied, right off the top of my head, the Nevada Housing Division, we did apply for our own DPA program, as did Nevada Rural Housing Authority, who has that. The Community Foundation of Northern Nevada applied for the home building, as did Habitat for Humanity. And then Rebuilding Together, both Southern and Northern Nevada, and Nevada Rural Housing Authority applied. And I know I'm leaving a couple out, but those were the main ones that I can think of right off the top of my head.
And just one last question. Will those awards be expected to be distributed next week as well?
Steve Acroft, for the record. Sorry, I didn't do that last time. Distributed is probably not the right word. But the preliminary awards, the notifications would probably go out next week, yes. Thank you.
Other questions? Not seeing any. Assemblyman Carlton.
So with that, Mr. Chairman, I would move for approval of item 13 and 14. I'm sorry? Am I on the wrong one?
9 and J.
9. Oh, I
nine.
jumped
Just
ahead.
9.
I'm sorry.
Just 9.
I'm sorry. I'm jumping ahead.
Yeah.
I've got my notes wrong. So just item number 9 and J is informational. So a motion to approve item number 9.
We have
I
a motion.
apologize, Mr. Chairman. I'm just trying to move us
That's
along.
right. I'm there too. I'm already on the 13, 14. We have a motion to approve item 9, second from Senator Canizaro. Further discussion on the motion. All in favor say aye. Any opposed say nay.
Aye.
Motion carries. All right, we're now going to go to item number 13, 14, and right after that, we're going to do 94, 95, since it's welfare, and so maybe that'll save time having you there, and but we'll do 13, 14 first.
Good afternoon, Chair Dennis, Co-Chair Carlton, members of the committee. I'm Lisa Swearingen, for the record, Deputy Administrator for the Division of Welfare and Supportive Services. With me, I have Administrator Thompson, and then to my left, I have my Chief IT Manager, Bart Linden. Currently, we're talking about D14. We also have D95 today. Both of these are system enhancements to our eligibility systems. D14 is a modernization request to move our system off of the mainframe onto our existing platform. And then D95 is to implement a no wrong door system with Access Nevada. Currently, we have a vendor on board that is making changes to both of these systems. So if we could request these funds in advance, or not in advance, but now, not later, we could amend our current contract and have the vendor add these two scopes to that contract and have them fully implemented before 26. With that, are there any questions?
Yes. Let me start first. So you've got funds set aside for the work program, which is the 17.3. Is that correct?
So the total is 48.5.
Oh, so the total is 48.5, of which
17.3 million is identified for the current fiscal year.
so you've got 17.3 for the current fiscal year, right? And then the 31.2 after this fiscal year. Is that correct?
That is correct.
Okay, and so as all these big IT projects, they take time, right? So are you moving at the level that you need to be moving as far as for completion?
For the record, Lisa Swearingen, yes, we are. We just signed a contract to have, like I said, several system enhancements made to our current eligibility engine as well as Access Nevada. Both of these work programs will be touching those systems. If we can get that contract amended and get these added into their current timeline, because they're already going to be in those systems, they'll be able to make those changes sooner rather than later.
Okay, and then you're gonna have an ongoing maintenance and operational cost of about 4.5 million. Is that accurate?
For the record, Lisa Swearingen, yes, and that's to address any possible system issues. 95 is going to be a really large task. We're looking to take in several different other agencies and kind of doing a no wrong door process so that our clients can come into one point and be able to access benefits from all these different entities.
Okay, so in the way I'm looking at this is, you've got to have what you need for the current fiscal year, that's 17.3 to move forward. But one of the thoughts as I looked at this and we were looking and discussing was that we could set aside the other 31 and just allocate it as you need it. Is there any issues that would come up because of that?
For the record, Lisa Swearingen, not at this time. We could build that into the timeline if that's what we needed to do, just making sure we could get it on the calendar to request those funds down at that time.
Right. So it would just be the way I would look at it is we would set aside in a special reserve account the money, and then you just have to do a work program to just move the money. Yeah, or put it in the budget for next session. So.
For the record, yes, that would work for us.
Okay, great. All right, other questions? Yeah, Assemblyman Tolles.
Thank you, Chair. And I think you and I might have been thinking the same thing, which was that currently you're on an incremental track of 35% of it has already been modernized, and this would just, it sounds like, expedite that 65%. And I just wondered if there was any fiscal advantage to expediting that, or what would be the benefit to expending the federal funds for this to expedite it now versus staying on the incremental plan that you would have been on had we not had this allocation.
For the record, Bart London, Chief IT Manager, through Chair Dennis to you. So if the question is, if we allocate the funds right now versus going forward, or, sorry.
That's okay. I think there is kind of almost two questions. What were you planning on doing if we didn't have this federal funding to allocate? You were already 35% of the way to modernizing, so I assume that there was a long-term plan to incrementally carry out the other 65%. And then is there is there some sort of advantage that we have fiscally to amend that plan using this money to expedite it so it's done by 2026? Is there a savings or a benefit?
Robert Thompson, for the record, I'm the administrator for the division. It was a piecemeal plan. We would be moving forward, coming forward bits at a time, asking for money bits at a time as we were forced into modernizing the rest of the system. Having this opportunity now would be cost effective. Each time we would have to go forward, we'd have to re-engage the vendor, possibly get a new vendor. We have contracts right now where those vendors are already in the system coding these same systems. So being able to do it now would be cost effective.
All right. Does that answer your questions? Okay. Any other questions? All right. I'm going to ask Vice Chair Carlton to make a motion.
And thank you, Mr. Chairman. I'll try to do a better job this time around. So my motion would be to allocate $17.3 million, the total expenditure amount identified for fiscal year 23, to the special use expenditure category, and allocate the remaining $31.2 million to a new dedicated reserve category for use in future fiscal years. And also in this, the revision will require that this be included in the executive budget in the upcoming 23-25 session, and that way that'll be fine. That would be the motion.
Okay. So we have a motion. Second, Senator Cannizzaro. Discussion on the motion.
And if I may, we've been through so many modernization projects, and some of them have gone very, very well, and some not so much, that we've had to really work hard to get them back on track. I think this is a great way to move forward incrementally, but still use these dollars wisely and get the job done, so that you don't have to come back for the next 5 legislative sessions to get this project done. You can get it done in the next 2 legislative sessions.
And so far, you're actually progressing. Well, you haven't come back to us to say there's a problem, right? That's good. Okay, further discussion on the motion. Hearing none, all those in favor say aye. 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 Any opposed say nay. Motion carries. All right. Okay, now you're up, and we're going to do 94-95.
So for the record, Lisa Swearingen, Deputy Administrator for the Division of Welfare and Supportive Services. To recap, D95 is a system enhancement to build what we're calling a no wrong door solution, which will be a cloud-based solution. A one point of contact or point of entry for our clients to come in and be able to access services from the different agencies that fall under DHHS. The Department of Health and Human Services. And with that, they would be able to come in, identify themselves, and be able to see, with putting in basic information, what programs or services they would have available to them.
Okay. We have some questions. Assemblyman C.H. Miller. Turn your mic on.
Thank you. So, we are
Actually, give me just a second before you go, because I want to ask the same question I asked on the last one. You've got on this one, you have 3.1 million. That's for the current fiscal year, and that would leave 9.4 million. That we could do a similar thing where you could have what you need for this fiscal year, and then have the other one set aside in a reserve account that you could just then draw.
Robert Thompson, for the record. The answer would be the same. We would be able to work with that.
Okay. All right, let me go back to Assemblyman Miller.
Okay, thank you. My apologies for that. So I'm just curious here if the agency, if the modernization project were to go beyond the December 31st, 2026 expiration date of the American Rescue Funds, what's the plan to complete?
For the record, Lisa Swearingen. Currently, we do not anticipate there not being the ability for us to complete it by that deadline, mainly because the vendor that we currently have is familiar with this system as well as the other agencies, and they'll be able to build those crosswalks for us and make that. I don't see us not meeting that deadline.
Okay, we're expected to finish in June, right? Looking at my notes here. When is the project expected to finish? June 2026.
Lisa Swearingen, for the record. I do not see a problem meeting that deadline.
You don't have to see it, okay.
No. And I'm sorry, if I may, we can provide updates once these are passed and I can get an amendment. We can provide you with an updated timeline.
Okay, thank you.
Mm-hmm.
We like updated timelines so that we know what's happening. Okay, any further discussions? Assemblyman Benitez Thompson.
Thank you so much. I just wanted to mention that I'm really excited about this because with the concept of no wrong door and everything that the division's trying to accomplish with that, knowing that this will help improve the score we've received on how we're streamlining that the application and the access to really kind of create that one stop is just wonderful. It's wonderful for people who are in the human services professions who are helping and working with clients and people who are vulnerable. It's wonderful families who want to try to seek for services themselves. And so this moves us towards a really important goal. And for as much of a aging population as we have and people who are vulnerable out there, being able to know the supports that the states can provide them and easily entering into that system is really important. So this is going to make, to me, when I see a lot of the stuff we're doing, this is going to be great at the ground level once it gets done. And then a comment on the last one, just because I was like, the nomads, and I was like, oh my gosh, are we talking about nomads? And so very appropriate to say that back in the late 1990s, I'm remembering that changeover from ADFC to TANF and then the child support stuff. It took us forever. I think there might be some people sitting out there, some professionals who have nomads PTSD from just trying to get the first system implemented. So the fact that we could fund the modernization of it in 4 years has to be just a welcome funding to get that thing done. Because in the worst case scenario, it could take 10 and go bad in a lot of different ways, when we were trying to stand it up. So these are good dollars going towards good things.
All right. Other questions or discussion? The one thing that we know for sure about any of the IT systems is modernization is something that just happens constantly. Because by the time you get it done, you're going to be already working on modernizing and going to the next level. So that's why you constantly are going to be seeing these here. Okay. Not hearing any further discussion. Someone, Carlton.
Thank you, Mr. Chairman, and I'm one of those people that lived through NOMAD's PTSD back in 1999 and 2001. So with that, the motion in the vein of the previous motion that we had earlier, hearing where the committee has kind of decided to move, my motion would be to allocate $3.1 million, the total projected fiscal year 2023 expenditure amount, to the special use expenditure category and allocate the remaining $9.4 million to a new designated reserve category for the use in future years. And would also like to include that as the executive budget looks at this, that they would look at it as an enhancement unit moving forward and using these reserves. That would be my motion.
Okay, we have a motion and a second from Senator Cannizzaro. Discussion on the motion. Hearing none, all in favor say aye. Any opposed say
Aye.
Any opposed say nay. Motion carries. All right. Okay, we're now going to go to 1718. That one was, let's see who pulled that.
Senator
Gansert. Yeah, Senator Gansert. So as they're coming up for 17 and 18, since rather than do a presentation, I'm just going to go straight to the question because we just had a question from one of our members.
Thank you, Chair Dennis. And so I'm looking at 17 and 18, and it's about making sure that we can get telehealth services to older adults. And when I looked at page 18.5, it talks about how many people are expected to be trained, and it says 200 professionals, and then it says this current project will train 150 right after that on page 18.5. So I'm trying to figure out if you're training 350 people, if it's a 200 plus 150, or if it's one or the other.
Dina Schmidt, for the record, Administrator for Aging and Disability Services. So the current project has already trained. It's the 200 that, 200 that the current project. The new project will be training the additional professional staff. So this is a professional development. It's professionals teaching professionals how to use telehealth and expanding the access. And we used our current older Americans, American Rescue Funds to start this project. And so this is a continuation. It's been so successful that we want to continue that work.
Thank you.
Any other questions? Senator Gansert, do you want to make a motion?
I'd make a motion to approve items D, 17, and 18.
We have a motion. Vice Chair Carlton, you want a second? Okay, we have a motion and a second. Any further discussion on the motion? Hearing none, all in favor say aye. Any opposed?
Aye.
Any opposed say nay. Motion carries. Okay, now we're going to go, thank you very much. Now we're going to do the big one, which is D33, 41, 106, 137, 34, 42, 107, 138, all together. And you can actually sing all together now because there's like four different divisions that are part of this. But it's,
Good afternoon, Mr. Chair and members of the committee. For the record, Marla McDade-Williams, Deputy Director of Programs for the Department of Health and Human Services. If you don't mind, I'd like to just do a brief overview, combining all of these workforce initiatives and kind of giving some background of how we arrived where we arrived. So we are pleased to have this opportunity to grow and support much-needed workforce needs to build a network of essential providers for the state's vulnerable populations. The areas that have been identified in these work programs have been recognized by leadership of the various divisions because of extreme workforce shortages and a need to be creative about how to address these dire issues. In terms of managing the proposals, we'll ensure that we have objective criteria in place for the selection of individuals who are committed to working in Nevada and who have the desire to serve the state's vulnerable workforce. That objectivity will be managed either through a request for proposal process or an impartial body of people who will assess the applicants. In some cases, as with the advanced practice nurses, they'll meet the additional criteria established by their respective educational institutions. And in other cases, there will be an assessment of a person's qualifications to ensure they can be successful in completing the program for which they're applying. We also have the benefit of knowing where the state's health professional shortage areas are, and to the extent possible, we'll ensure that individuals who qualify for the scholarships and opportunities meet an underserved need, including in rural and tribal areas. As you may know, the health professional shortage area is an area that lacks statewide access to preventive and primary care services, experiences a shortage of primary care, mental health, and dental providers, experiences key barriers in access to health care, such as lengthy wait times and travel times, demonstrates the highest need for health services such as levels of poverty, infant mortality, low birth weights, life expectancy, and percent of or number unserved and underserved. And it has insufficient training for providers in the respective areas. 10 of Nevada's 17 counties are single county primary care shortage areas, including pockets of areas in the state's 2 largest counties. As we consider post-training requirements for individuals who are awarded these opportunities, we anticipate getting a commitment from the individuals to continue their work in Nevada, and if possible, with our programs, but we recognize that sometimes a person's life situation interferes with their plans. If someone is unable to fulfill the commitment, we feel comfortable that our efforts have contributed to a higher educated workforce for the state of Nevada. We also recognize that this is one-time funding, and while we wish we had continued funding to build our workforce, we know that directing training towards these needs will ultimately benefit all of us. With some of the programs, we'll have continued access to training curriculum that can be used to continue to provide opportunities as needed. Additionally, we have some opportunities to apply for grant funding that might be used to continue these efforts, and in some cases, private philanthropy, and we may also ask agencies we partner with to consider sustaining these efforts. But the one-time ARPA funds will meet a need that isn't being met now. And as I opened with, we're pleased to have an opportunity to help build the state's workforce. Thank you, and I'm available for questions.
All right, thank you. We start with Assemblywoman Gorlo.
Thank you, Chair. Thank you so much for being here. I'm really excited to hear about these scholarships. So I just had a couple of real quick questions. One, why is it most appropriate for the funds of these scholarships and workforce development programs go through the Department of Health and Human Services? And how will you also advertise or let people know about these programs?
Again, for the record, Marla McDade-Williams, the department just recognized that there are some severe needs out there, and unless we stepped up and actually did something, those needs would continue to be there. So we know that in serving the vulnerable populations that we serve, if we don't have adequate staffing, we're not going to be able to serve them. So we had to do something, and that's what prompted us to do this.
Great. Again, I think it's a wonderful way and a quicker way of getting that workforce out, starting from within the healthcare field rather than starting from scratch. And so I have another question about the recipients. Would there be some sort of obligation with them to work in the healthcare field within the state for a set period of time in order to receive these scholarships?
For the record, Marla McDade-Williams, as we set forward the criteria, we will ask that people make a commitment to ensuring that they are going to stay in the state and follow their obligations. We can do so much, to do that. Life happens, as I said. But as part of the criteria for their application, we will ask them to commit.
Great. Thank you very much. I'm excited to see this go to fruition.
All right. Other questions? Okay, we'll go to Senator Neal, and then we'll come back down. Okay, I have Titus. Okay.
Thank you, Chair Dennis. So I just had a quick question. So would this expand or is it contemplated to expand if, let's say you have a person that's currently working for Division of Behavioral Health or DHHS and they want to go to medical school, they're thinking about shifting into policy, with the scholarship apply to them?
Marla McDade-Williams, of course it would. We'd give every opportunity to anyone who is able to make it work into their lives.
Okay. Thank you, Chair.
All right. Let's go to Assemblywoman Titus.
Thank you for that, and appreciate expanding the workforce. We all know that access to care is probably the single biggest hurdle we have in Nevada at this time. My question falls along the same line of obligation to work in Nevada. And you mentioned that you're going to ask that would be one of the criteria. And then you said life happens. And so in previous programs that I've been aware of, you have certain obligations if you don't come back to Nevada because life does happen. And that would regard payment, paying off whatever that cost was. Are you going to have anything like that? Or you just say, hey, we really want you to come back to Nevada? What's going to be the actual true mandatory obligation?
Thank you. Marla McDade Williams. We'll work with our Deputy Attorney General to see what kind of legal criteria we can place on the allocations.
Okay, we got Senator Hafen.
Thank you, Mr. Chair, and thank you for being here and presenting. I too echo the concerns with bringing them back, because the last thing we want to do is spend money. So any legal language that we can add to that, I would like to see added as a condition of approval for these funds, because to me the most important thing is to get them in Nevada and keep them here. I do want to touch a little bit on the scope of work, especially when it comes to children and our youth. I mean, we just had the DOJ come out and say we have a huge problem. We're dead last right now. And so I kind of want to know the scope of work when they get out of school and how that's going to work to hopefully address what the DOJ just reported on us. Thank you.
Marla McDade Williams. I'm not the person to talk with about the actual investigation, but I can say that we recognize again that there are shortages, and our obligation is to figure out how to address those so that we can build networks and have adequate systems out there. And so part of the goal of this is to ensure that we are building systems so that we don't fall into that category of being investigated because we aren't providing the services we're supposed to be providing.
Okay, let's see. Senator Sievers-Gansert.
Thank you, Chair. Thanks for being here today and for bringing these forward. So I was looking at D34, specifically personal care workforce. You talk about incentives in the form of offsetting training fees with forgiveness if a trainee works with low-income, vulnerable populations. And so I'm just going to ask about the accountability on that part to make sure that we don't train people to really serve those underserved, and then they go, work somewhere else. So I'm not concerned about them being in or out of the state, because I think most of them will stay in the state, but to make sure that we actually are able to affect access and service to the low-income, vulnerable populations.
Marla McDade Williams. I think one of the challenges that we have is that it's difficult to find any type of a trained workforce. So we're trying to incentivize people to come in and get the training, and we believe that once they get the training, they'll want to serve the people that they have indicated that they wanted to serve. Right now, we are having difficulty even getting people to qualify for positions. So once we can invest training in them, we believe that they'll invest back in us.
If I can follow up, so what does that mean, that you're having a hard time just because there's not folks that are, you said qualified, that they're not qualified?
Marla McDade Williams. So we talked about the vacancy rate earlier. I think at the Department of Health and Human Services, it's a little bit higher than the overall state vacancy rate. And so it's, when you can have someone who doesn't have to pay for their own training to be able to qualify for these positions, working at a fast food chain, and we can provide them the opportunity. We're going to pay for your training, so that gives them the incentive now to come into the state system, where right now they don't have that incentive.
Thank you. And to follow up, so do you have the flexibility within this program to provide more incentives than just the training, like something to help them get into this workforce? Because you're right. I mean, you can go to a lot of lower wage, unskilled positions that are actually higher wage right now because of the market rate. So just if you have enough flexibility, because I think that's part of it, and that's something that we face, all the challenges that we face all the time is really trying to get people into these positions and help them stay there. And if you have enough flexibility to incentivize the program.
Tina Schmidt for the record, Administrator for Aging and Disability Services Division. So when it comes to the personal care workforce training, this is one strategy that's been recommended by some federal Milliman report on direct care workforce policy and guidance action. This is one recommendation of theirs, is to create a curriculum that's stackable, which is what you're getting to, so that there's incentive to continue the training project. And as they get more certifications, there's an incentive with employers to pay them more money. They could get a specialty in dementia care, for example, behavioral health care, those types of things. So it's really about getting the workforce trained, but then also creating a pathway for them to continue through the healthcare field.
Thank you. I appreciate the thoughtful approach to this because we do have tremendous demand for these types of services. Thank you.
Other questions? Soon, Carlton, I believe you had a question or a comment.
And I just wanted to say that I appreciate the path that you're trying to take. You know, initially my first thought was, well, why not DATER? Why not Office of Workforce Innovation and all those types of things? I think these amounts of students would get lost in those big, huge programs, and I realize you brought these ideas forward, so therefore when they said, yes, they're a good idea, they handed them right back to you to implement. So be careful for what you ask for. But because of these numbers, I think it works well, even though you guys do have a vacancy rate. That does concern me, but I think this amount of students that we're talking about will have a significant impact on what's going on. And I'm not as concerned about making sure they stay in the state and repay the debt. We've got programs out there now where people can get a scholarship and they have to stay in the state, and we still have an access problem. So why make the same mistake again? These are going to be Nevadans working in other jobs who are going to want these trainings or on that ladder somewhere and want to upgrade their skills. So we found that once we get them in Nevada, we can keep them in Nevada. So I'm not as concerned about that. The one question I did have was, some people they think they can do this and they really want to do it. You get them in a class and they're just not going to make it. So how are you going to deal with moving them out and possibly moving somebody else in? Or is that going to be all within the RFP for the contractors to figure out how you manage it? Because they may think they can be, you know, a personal care assistant, and then they find out what's really involved in it, and it may not be their cup of tea.
For the record, Marla McDade Williams, I think you answered your own question.
Yeah.
It is through that assessment and RFP process.
Okay. All right. Thank you very much.
Any other questions? Assemblyman Benitez Thompson.
Yeah, I was hearing some comments, and some of them just didn't seem to be, because through these different work programs, you're addressing really kind of from your front line all the way to the APRNs, all the way to talking about public health services, like a lot of different types of providers. And so at least for the frontline caregivers, for what you're doing in the 33 and 34, D33 and 34, I think echoing what Assemblywoman Carlton says, it makes no sense to put a Nevada requirement on this. For people that raise their hand and say they want to do some type of personal care, we're scooping them up and we're giving them all the training, and then we're praying that they stay doing that work, because it's the hardest work that's out there. That's helping people with all their activities of living. Bathing, grooming, and dressing people. And believe me, it is hard work, and there are not a lot of people that want to do it. And when family members need someone to help care for someone, they start calling around for these people to come in. So we scoop up anyone we can in 33 to 34. And quite frankly, we just ask them to work. I don't think we put any other strings on that. On 41 through 42, those are... once again, most of the professionals that we have here are also ones where if they raise their hand and they say they want to do the work, the community health workers, the doulas, and all of that, we scoop them up and we say absolutely, and we give them the money to do this. I had a quick question, because I'm one of these is clinical rotation scholarships, and I didn't know exactly who we were talking about for clinical rotations, but it looks like we're only reimbursing them $59 a day per diem, so I don't think they're physicians, because that's not happening at $59 a day. So, but whoever that is who's taking a $59 a day per diem, if they show up and they want to be here, give it to them. Oh my gosh, like we're doing that, right? And then the APRNs, once again, I think most of them are going to stay in the community. There's so much of a need for APRNs. I think they're going to stay here and that they're going to work here. The only comment I would have with the on D107 and 106 for APRNs is that the only thing that it kind of makes sense is, you know, Witchy does have an established program to help with APRNs, and I know because of some of the changes we made through that program last year that they weren't, I don't think, able to fund as many of the APRN slots as they had been, and I haven't talked to Witchy, but it seems like we might already have infrastructure for that specific one. And I don't know if it makes any sense to talk with them to say, like, if we handed them that allocation or if they came forward to get that contract, they get these, like, hit the ground faster with these dollars since they seem to already work in that vein anyways. So I just didn't want us to get too carried away on the committee and make any of this money more onerous than it has to be.
For the record, Dr. Cindy Pitlock, excuse me, I serve as the administrator of the Division of Child and Family Services. Through you, Chair Dennis, to you, great question. I really think that for the APRN scholarships that we do need to engage a vendor that can look widely for us. There are registered nurses that want to engage not only in-state APRN programs, but Nevada citizens, Nevada nurses that want to engage out-of-state programs, not because they want to move out of state, but because of the particular flexibility of that program or because that particular specialty is not offered in the state of Nevada. So, for example, myself, I'm a women's health nurse practitioner, and here I am, right, in the state of Nevada. I actually went to State University, Stony Brook, Long Island, and came right back home and happy to be here. So I really think that if we were to engage a vendor that could help us manage that and allow the registered nurses full flexibility to secure that APRN scholarship. They are Nevada nurses, and they have committed to the field of nursing. That is their chosen profession, and we're only empowering them to become full scope providers and to return to Nevada.
Other discussion? Not hearing any. Assemblywoman Carlton.
Thank you, Mr. Chairman. I would move for approval of items 33, 41, 106, 137, 34, 42, 107, 138. I realize those were out of order, but that's how they're listed on my sheet.
Thank you. We have a motion and a second from Senator Cannizzaro. Further discussion on the motion? Hearing none, all in favor say aye. Aye.
Aye.
Any opposed say nay. Motion carries. All right, thank you.
Mr. Chair, while I'm up here, I have 116 and 117 too. Would you mind going to that?
Yeah, we could do 116 and 117. That's D, right?
Yes, that's the Oregon Donor Network.
Okay, and then that one we just have a question on. So let's see, who was that? 116. That was. I'm not sure who. Oh, Dr. Titus, you have a question on this one.
I'm a little more. Thank you, Mr. Chair, and thank you for staying up there. And absolutely supportive of the program. And I had a question regarding, it's a one-page definition or in our books to give us some more information. And I'm concerned that the $15 million is not enough. And I want to see, I think that we need this program. It's long overdue. I'm very supportive of it. I know that these monies are looking, throughout the state. We have citizens that leave our state. I've taken care of many patients that had to leave the state for their transplant, whether it was a kidney, liver, heart, lung. And my concern is how much is really needed to set up this program. How far would this $15 million go? And why were you not awarded more for this program when we have $97 million left in this monies? I'm just concerned, as an earlier agenda item, that there maybe should have asked for more money. And that's where I'm coming from with this, that I want to see this program go. I want to see it go as expeditiously as possible. And I'm concerned that the $15 million is not enough.
Thank you, Mr. Chair. For the record, Marla McDade Williams, Deputy Director of Programs for the Department of Health and Human Services. I think it was the same discussion you had earlier with Senator Garcia. I mean, there are so many priorities that you can set aside with the money that's there. And we looked at hundreds and hundreds of applicants. They did request $20 million. They didn't, and we were able to allocate 15.
And thank you for that explanation. So if they only get the 15 and they needed 20, will they be able to move forward with this 15? And is there a possibility that if some of the funds, of these funds that are not expended, could they come back and ask for more?
For the record, Marla McDade Williams. My understanding is that they proposed some private philanthropy to meet their needs as well. So, we're entering into a partnership with them to support the efforts because we recognize the need. But, if the legislature wants to allocate more funding to it, I don't think that we, would oppose that at all. If they did have a need to come back and there was funding available to do it, but that's it's really your decision at this point.
And again, my line of question is really about getting this program moving forward. We do have this money, but is it now going to be a year? We've heard multiple times today that this is like an emergency, that we're moving forward rapidly and all of that. But I want to make sure the state itself is not getting in way of by saying, no, you can only have 15 when you probably had the leverage to give them the 20, is not really slowing down this process. So looking forward to further conversations, and that's the only questions that I had, Mr. Chair, and I would move unless somebody else has a question.
I think Assemblyman Carlton has a question. Anybody else? Assemblyman Carlton.
And thank you, Mr. Chairman. And typically, as the folks that sit on this committee for the last 4 years know, that when folks come to the committee, we usually ask them to go get the matching funds first and then come back to the state. So when we do our large bills at the end of session, we ask them, go find your matching funds, and then they come back, present it to us. We hold the money in reserve. When they get there, we give them the money. This is totally different. We are giving them the money up in front, no matter whether they make that other $38 million or not, because we believe this is very important. Tough decisions have to be made sometimes. If we wanted to give them more money, I'd like suggestions on who you'd like to cut, because that's what we would have to do, is take money from someone else in order to be able to do that. I know there's a lot of feelings out there right now about an extra $900-some million out there. There is no extra money in the state. There's no such thing as extra money in the state. There's a lot of costs that are going to be coming up over the next 4 to 6 years. So I appreciate wanting to give them more money. There's a lot of other charities and a lot of other very good causes I would like to give money to also. But at this time, we're actually going a step further with this group than we normally do by just saying, yes, here is the money, go do this very good work that we would like you to do. And I'm sure if they need our assistance in the future, I won't be here, but I can't imagine anyone sitting up on this dais would be willing to tell them no. So I invite them to come back if they need to come back. But right now, this is the amount of dollars that we can actually expend towards this issue.
Chair, may I add to that?
Go ahead.
Bailey Bordelin, for the record, Deputy Chief of Staff to the Governor. I just wanted to clarify on the process that what we received was that there was a $20 million need from the organization. And like has been mentioned previously today and at previous meetings, these weren't true applications in the sense that we didn't have all of the information. So this was identified as a high priority and need for the state. And the nonprofit was brought into conversations with the state to work out a joint funding agreement that made sense for the state's responsibility to support this nonprofit and support this important endeavor that is obviously a very high priority, because $15 million is a significant amount of money to give to a private nonprofit, but that the spending plan that you have before you is a joint effort that we worked on with the nonprofit and reached a conclusion that we believe, and you heard through public comment, they are very happy with.
Great, and thank you for the clarification, and looking forward to this coming to fruition. Thank you.
Yep.
If it's okay with the chair, I'll move to approve 116 and 117.
Okay, we have a motion to approve. Second, Senator Canizaro. Further discussion on the motion? Hearing none, all in favor say aye.
Aye.
Any opposed say nay. Motion carries. All right, so that was 116, 117. Now we will go to 39 and 40, also one from Senator Titus. And we're going to go straight to the questions.
Thank you very much, Mr. Chair, for the questions. Again, looking at the one-pager that was submitted with this documentation, first and foremost, I'm supportive of the application. I'm supportive of long-term contraceptives. My question is, according to the page that was submitted, this is basically for IUDs. And I'm wondering, and it's going to be that you're going to reimburse for the IUD itself, but not reimburse for the actual insertion of the IUD or removing the IUD. And so are you looking at purchasing these IUDs and then supplying them to the providers? And if so, what providers are you looking at? And number two, did you consider anything like Depo-Provera or alternatives to the IUDs? A lot of women cannot have an IUD.
Thank you for the question. For the record, Melissa Lawfer-Lewis, Administrative Services Officer for the division. So in terms of reimbursement, we currently reimburse the federally qualified health centers and the rural health clinics for the insertion and the removal via our PPS rate. It is the actual contraceptive that has a greater cost and is a bit cost prohibitive for these providers to insert or to provide. In terms of your second question, I believe we have Dr. Capurro, who is our Deputy over Medical Programs, that can assist with that question.
Good afternoon, committee, and thank you for the question. For the record, I'm Dr. Antonina Capurro, and that is correct. So the insertion of the IUDs will be paid separately by the provider. They will bill us. And the FQHCs or the rural health clinics will receive their PPS rate, their encounter rate as they would normally. This specific form of contraception was the one that was most problematic for our FQHCs and our rural health clinics. And so this was the one that was selected for this project. If there are others that we need to look towards in the future, that can be part of this project as we unbundle this and pay for these separately.
So thank you for that. So just for clarification, they're going to bill separately now. You're not going to provide them with the IUDs, but they will get reimbursed. So they'll have to purchase them up front and then bill, and Medicaid will pay at the cost of that device?
For the record, this is Dr. Capurro. Thank you for the question. Yes, so our funding will come from our administrative budget. We'll be reimbursing providers directly, and as well as providing that encounter payment for the FQHCs for the insertion of the device as well. The long-term goal would be to unbundle these so that they're paid separately, but that would require budget authority.
Thank you. I like the concept of unbundling. Thank you very much.
Anyone else have a question on this? Dr. Titus?
With that, Mr. Chair, if it's okay, I will go ahead and move to approve agenda items number 39 and 40.
Okay, we have a motion, second from Senator Cannizzaro. Further discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Any opposed say nay. Motion carries. Okay, we're going to go to 43 and 44. Assemblyman Titus.
Thank you, Mr. Chair. Thank you, Mr. Chair, and for allowing me yet another question. This revolves around the dental health programs, and I'm wondering, this will be what the statement said in our short book was that it was dental health programs for children. What the documentation says when we got the full packet is that it's dental health programs for schools. And so I'm just wondering I need a little bit more explanation about what the outreach is going to be on this program, because there really isn't any explanation that I was given or that we were given in our books. So it's $2.736 million to go into this program to support dental health programs in schools. where is this? What schools are you discussing? What schools are you looking at throughout the state? Are you hiring? Is our dental health officer going to be doing this? What are we looking at with this?
For the record, this is Dr. Capurro. Thank you for the question, Assemblywoman Titus. So this program is for a school-based sealant program. So this is specific to those programs that would be built that would go into underserved schools, typically Title I schools, and would serve all of the children within that school. What we saw during the pandemic was that a number of these programs closed. Initially, our projections were 75% of the programs closed throughout the state, and that number now is closer to 50%. But this project will not only establish new school-based sealant programs, but expand them so that all students within the schools will have access to these preventative dental services. I do have with me our state dental hygienist, Jeanette Gomez, and she has some additional statistics about the program that she can share with the committee.
Thank you, committee, and thank you for the question. For the record, this is Jeanette Gomez. I'm the state dental hygienist working for the Nevada Oral Health Program. The Nevada Oral Health Program developed the Oral Health State Plan that's spanning over 2022 to 2032. And within the state plan, we included the burden of oral disease in Nevada. In our research, we found that Nevada children ages 1 to 17 had higher rates of fair or poor condition of teeth compared to the US. Nevada children ages 1 to 17 had higher rates of decayed teeth or cavities compared to the US. We also found that 20.3% of Hispanic children have decayed teeth or cavities compared with 11.5% of white children. In addition, 25.4% of non-English speaking households have children with decayed teeth or cavities compared with 13.5% of English speaking households. School-based sealant programs reduce the incidence of tooth decay by 40 to 60%. School-based sealant programs will help to improve the health equity and access to care for all Nevada's children with a focus on oral health disparities that impact oral health. According to the CDC, school sealant programs are a highly effective way to deliver sealants to children who are less likely to receive private dental care. So these sealant programs will be a safety net for children who face barriers to care. Thank you for your time.
One final question, if I might. How many students do you actually intend or hope to reach with this $2.7 million?
For the record, this is Dr. Capurro. Thank you for the question, Assemblywoman Titus. I'm just looking for those projections because we did have that initially in here as we had some oral hygiene supplies that would be provided directly to each child. I believe the number was 100,000 children across the state that we were hoping to serve through this opportunity. This will be a competitive grant opportunity to those individuals that would like to expand or build a school-based sealant program. And we also have funding within this opportunity for a sealant coordinator who will also be reporting back information that will show the impact of this program.
Excellent. Thank you. I have no other questions, Mr. Chair.
Thank you. Anyone else have any questions? Dr. Titus,
with your permission, Mr. Chair, I would like to make a motion to approve agenda items D, 43, and 44.
Assemblyman Titus has made a motion. Second, Senator Cannizzaro. Further discussion on the motion? Hearing none, all in favor say aye. Aye. Any opposed say nay. Motion carries. Okay, we will now go to 5354. Assemblyman Titus.
Thank you. Mr. Chair, I appreciate the opportunity to ask some additional questions. 53 and 54 are related to monies to support an education initiative regarding red flag laws. I'm just wondering about what that education program looks like. Where do you intend to implement this? And because I didn't get much with the documents that were submitted.
Thank you, Chair, Vice Chair, and members of the committee. My name is Jessica Adair-Brennick, for the record, representing the Office of the Attorney General. I am joined by my colleague, our CFO, Jessica Hoban, today. To give you a bit more background about this program, the AG's office is requesting $400,000 to fund a gun violence prevention program. As you all know better than most, Nevada passed a law in the 2019 legislative session that permits a court to issue an extreme risk protection order to temporarily remove firearms from a person who is engaging in violent behavior. And only a family member or law enforcement officer may apply for an extreme risk protection order, and it's colloquially known as a red flag law. Reporting from the Nevada Independent revealed that between January 2020 and July 2022, only 13 such orders have been issued, and that rate is far lower than other states with similar laws. So our program will have a two-pronged approach. First, we would like to offer training opportunities for law enforcement agencies to ensure that officers know this tool is available to them and so that they can pass this information to victims and their families. And our office is well equipped to do so, as we are a statewide law enforcement agency. We host the annual Law Enforcement Summit, and we have a good relationship with Post and other agencies throughout Nevada. In states with red flag laws like Nevada's, law enforcement officers apply for the vast majority of these protective orders. The second part of this program will offer grants to community organizations, including faith-based groups, victim service providers, mental health providers, veterans organizations, and others to provide culturally competent education, outreach, and resources to families who are struggling and maybe looking for tools to help a family member in crisis. This is called the Help the Helpers model. What we're looking for are those leaders in our communities who families turn to when a loved one is showing signs of suicidal ideation, violent behavior, or other, quote, red flags. We want those helpers to have accurate information so they can offer assistance. So here's a tool you can use if you're concerned that your loved one cannot safely possess a firearm. So in AB 291, the bill did require county clerks to assist family members in obtaining one of or applying for an extreme risk protective orders, but this would be an outreach and education model with community-based organizations. So trying to let people know about this tool available to them before they end up at the courthouse to apply for that kind of order. I hope that answers your questions, Assemblywoman Titus. I did prepare a great number of research and statistics about suicide, mass shootings, and domestic violence as it relates to extreme risk protective orders. But in the interest of time, I'm happy to provide that upon request to the members of the committee. I will just make this one note. As many of you know, AG Ford chairs the Committee on Domestic Violence, and one of our statutory duties is conducting the statewide domestic violence fatality review. The case that we reviewed this year was a murder-suicide. A Nevada man shot his wife in the head and then turned the gun on himself. And there were 4 children under the age of 8 in the home. That shooting happened 46 days before the red flag law went into effect. And at the time, there were members of that family who were applying to the court to have children removed from the home because of domestic violence. The man had been previously convicted or arrested for domestic violence battery. However, that charge was reduced to a simple battery, so he was in legal possession of his firearm at that time. We will have no idea, we will never know if the red flag law had been effective at that time, if that would have made a difference. But I would like to think that if we are able to prevent that from happening in the future, we should take that chance. So I'm happy to answer any other questions.
Well, thank you. That certainly is a compelling story, but I think the issue is with the courts, not with perhaps a red flag law. That's all the questions that I had, Mr. Chair.
Okay, thank you. Other questions? Okay.
Mr. Chair, I'm not going to move to pass this.
Okay.
You've got everybody.
Yeah.
I move.
Okay. I'll take a motion from Danielle Monroe Moreno. We have a second from Senator Cannizzaro. Do we have further discussion on the motion? All in favor say aye.
Aye.
Any opposed say nay. Okay, we have some nays. Titus Hafen. Is that it? Assemblywoman Dickman. And Senator Hammond. Okay. All right, motion passes. We're going now to okay, we'll now go to 61 and 62. Can we? Okay, so we've got a question on this one. Can you just give us a 30-second update on where you're at as far as the progress, and then we'll go to the questions.
Yes, sir. For the record, Joe Bernardi, Department of Taxation, Deputy Director for IT. You got Senate Bill 414 funded us to continue our modernization project, Project Mint. In the last 2 years, we've hired staff for the project, including some people up here. We have brought on Gartner to help us write the RFP. We've gathered the requirements, and we're in the process of now documenting the RFP and getting ready to release it sometime January timeframe for the big system modernization.
Okay, thank you. Senator Neal, I might have just preempted what you were going to ask, but go ahead.
Thank you, Chair. So this is really quick. When are you guys going to fully implement this new system? I know that new system has a whole lot to do with some of the revenue legislation that's passed and whether or not you guys can implement it successfully. So when will it be fully implemented? What date?
For the record, Joe Bernardi, Deputy Director IT for the Department of Taxation. Our plan now is to have a 3-year implementation beginning in fiscal years 24, 25, and finishing in fiscal year 26.
Chair Dennis, can I have a follow-up?
Yes, go ahead.
So what does that mean in terms of, I guess, revenue policy that may need new, I guess you may have to program that comes out in 23? Is that going to have an enhanced fiscal note?
Joy Grimmer for the record, Administrative Services Officer. So for the first few years of this, we would have to run both of the systems. So we would likely put a fiscal note on that and have it work within the existing system TAS and then write it into either a change in scope or work with that vendor to try and implement it into the new replacement system.
Okay, I have a follow-up, but thank you, Chair, because it's already late.
Okay, thank you. Just a quick question, and you may have heard the discussion earlier. Earlier, we had some that were requesting money for the current year, and we talked about doing a special reserve. So in your request here, you are not asking for a specific request for the current fiscal year. Is that correct?
Joy Grimmer for the record. That's correct. This would be funding that comes in fiscal year 23 and is spent in 24-25.
Okay, so if we put it in a special, as we discussed earlier, put it in a special reserve account, and then you could just do a program request to get the money, would that impact what you're doing?
Joy Grimmer for the record. No, that would work for us. Are we looking at the entire amount going into reserve and then prior to the next fiscal year coming back to IFC, or do you have any details on that?
Yeah. I mean, I could have. Yeah, you could put it in the executive budget then it would all go in reserves, and so that's, I mean, that would work.
Okay, Joy Grimmer for the record. Thank you.
Okay, thanks. Other discussion? Mr. Assemblyman Hafen.
Thank you, Mr. Chair, and I appreciate you guys being here today. I didn't get the backup for this item until Tuesday afternoon, so your 30-second presentations really helped me, and I mean no disrespect, but I can't support this at this time. We're allocating 24, 25 funds. I really think that, based on the backup that I have, we're not looking until June of 2023 to do anything here, so I think that this needs to be fully vetted during next legislative process. Not saying it's a bad idea. I think it's probably a good idea. However, I just think that based on the timing, that this isn't one of those projects that, we're running into a brick wall, or we'll run out of the money. We'll run out of time for the 2026. I do think that this project could be further discussed next legislative process. And again, I don't think it's a bad project. It's probably a good project. Just with the limited time that I've had to review this, I can't support this at this time, and so I just want to get that on the record.
So, Assemblyman Hafen, I just want to make sure you understand what the motion is probably going to be, that we put it in a reserve account. It goes into the governor's budget. It'll be fully vetted during the legislative session before any money is allocated. But we would allocate it into the reserve account, into a special holding account now, and then it would come to the session as part of the governor's executive budget.
And I understand that on the other items where we had timing issues. This one, I don't see a timing issue. And please correct me if I'm wrong, if there's a timing issue where we need to go ahead and move forward. I just don't see one in the backup material and what's been said on the record today. So thank you.
Yeah, and I believe, and just so that we're clear, you're already doing stuff on the project now. Is that correct?
Thank you. Jason Giesler for the record, Department of Taxation. Yes, we are already moving forward in the project. Fiscal year 19, we were approved for a study. That study's been conducted. Gartner's come on board. We're already moving with some vendors through the process of getting going on the modernization project. So this funding would really set us up to continue along that path.
Right. So it would keep you on track to be able to get done on time. Okay, great. Thank you. Any other discussion? All right. Assemblyman Carlton.
And thank you. And just to clarify, coming to a reserve is much easier than getting through the budget process. So when they do hit that threshold of where they would need the dollars, doing a work program to pull money down out of reserve is much easier and quicker done here at a meeting like this, whereas in the budget process, it would be June of next year before they would see it. So we don't want to slow the process down, but by keeping it in reserves, we also keep our accountability measure intact. So thank you, Mr. Chair.
Assemblyman Titus.
Thank you. Along that same line, though, so you can obligate these funds, though, if we put these in a reserve, you can obligate these funds, so then we're obligated to give you them, like you could authorize the work programs and potentially spend these funds in a reserve, and then you're asking us when you need to pay it to take it out of the reserves?
Yeah, so if it goes, I mean, if they do a work program, it still has to come back to us before they could obligate it.
Right, so we're not going to be in arrears, like saying, well, we okay this program, it's been done, they're proceeding with the job, and now we need this money. They can't do that until we give approval, correct?
Correct. What we would do, and we don't have a motion yet, but it's similar to what we've done with the other ones, we would put it in a special reserve account. Then they have to come back with a work program to justify, and then we would either approve or not approve. Is that correct? Yep. Okay, yeah. Other questions? Okay, Assemblyman Carlton, do you want to make a motion?
So thank you, Mr. Chairman. So I would move for approval of item 61 and 62 to approve the revision. Let me get the correct numbers here. The full $42.8 million to a new dedicated reserve category for the use in future fiscal years, and also with the caveat of putting that this, as they move forward, this should be an enhancement in the next budget.
Okay, we have a motion. Second, Senator Cannizzaro. Discussion on the motion. Okay, hearing none. All those in favor say aye. Aye.
Aye.
Any opposed say nay. Okay, just raise your hand real quick. So we got Hafen and Titus. Okay, motion carries. Okay, our next one is 85, 86. Thank you very much. Let's go to 85 and 86. Okay, all right. Go ahead. Just be as brief as you can on your presentation, and then we'll go to questions.
Good afternoon, Dina Schmidt for the record. This work program requests $14,520,000 to help us address the needs for dual diagnosed individuals with intensive support needs. I think there's some clarity I'd like to add is that the $520,000 of the funding will be used to contract with a vendor to help us create a request for proposal, as well as work with us to move any services into our waiver so that we can sustain any services that are identified through this project. The additional $14 million will be used for direct service. I know the language on the work program made it look like we were giving $14 million to a vendor, so some of you may have questions. So just to clarify that we are not giving $14 million to a vendor. So with that, we'll take any questions you may have.
Okay, thank you. Assemblyman Carlton.
Okay, so I guess the question is, this is temporary funding. This is a significant issue that does need to be addressed in the state. What is the plan moving forward?
Dina Schmidt for the record. So like I said, really is identifying what services, and that's part of what this vendor will help us do, is identify the services that are needed that we can move into our current Medicaid waiver for sustainability.
Okay, all right. I think that's... Go ahead.
Okay, let me, in addition to that, can you discuss how you would ensure alternative funding is in place so that the provisions of intensive behavioral support services not interrupted when the American Rescue Plan Act fund runs out? If this request is approved.
Right. Dina Schmidt for the record. So I think that's one of the challenges we have. I guess it might help if I explain a little bit about the service provisions that we do for people with intellectual disabilities. We're finding more and more people unable to receive services. So we're seeing money go unspent. Even though we have the money, our wait list is getting higher because there's no providers out there. So the purpose of this is really to find providers that have a higher level of specialty services to help us with those intensive support needs. So really, as we move forward and identify new services that are needed or just providers that can provide those services, our current waiver funds as well will be used to sustain these services going forward.
Okay, other questions? Senator Gant.
Thank you. Thank you, Mr. Chair. So I appreciate you bringing this forward. I've had some bills that amended the state plan, for Medicaid, and I feel like we're always trying to catch up on what other states are doing, and we're not necessarily maximizing the potential resources to the state with the matching dollars that we can get. So I appreciate you bringing this forward, and I think we should be doing more of this. It's really an assessment of what we're doing, how we're doing it, what other states are doing, so we can maximize federal dollars to our state. So just something to think about. Thank you.
Thank you. Other discussion? Other questions? Okay. Assemblyman Carlton.
Thank you, Mr. Chair. So I would move for approval of items number 85 and 86.
We have a motion to approve 85, 86. Second from Senator Canizaro. Further discussion on the motion? All in favor say aye.
Aye.
Any opposed say nay. Motion carries. Okay, we're now on 91, 92, 93, which is the Office of the Governor, Department of Health and Human Services.
Good.
Go ahead.
Good afternoon. For the record, Melissa Lawfer-Lewis, Administrative Services Officer for the Division of Healthcare Finance and Policy. This work program creates supplemental payments for skilled nursing facilities as well as Nevada assisted living facilities. So currently these facilities have had major cost increase the last several years due to the pandemic as well as other items. And our Medicaid rates have not increased to the level to help support the increases that they're facing. So this work program would create supplemental payments to help offset that, offset some of the losses that they have faced the last couple of years. This request also includes a contractual position that will manage these supplemental payments and work with the stakeholders regarding the program specifics. So with that, I would be happy to answer any questions.
I know we have someone, Benitez Thompson. I keep thinking of super...
What?
Super rock and roll. Super rock star.
I don't play any instruments. I don't sing. I've never been in a band. I think I'm the least rock and roll person that there ever is.
Can you
now,
make
if you
your
go
head
like
go
late
like this?
90s R&B, I think there's a window there, but...
Okay.
All right. Thank you, Chair, for allowing me to ask questions. I appreciate it. Let me move so I can see you. So the absolutely legitimate need here, and like the idea that you're going to bring someone into the office, hire them via contract to establish a supplemental payment programs to the assisted livings and to the nursing facilities. I guess the first question I have is it looks like there's already been a decision that all facilities would be included, even those who don't take or service Medicaid patients. So could you talk a little bit about how, as a state, we would justify a supplement to the facilities that don't have Medicaid patients, especially when so much of the argument is based on our low Medicaid reimbursement rate?
Thank you for the question. So I believe we have Dr. Capurro on the line that may be able to assist with that question.
Yes, good afternoon. I'm Dr. Capurro for the record. Thank you for the question. So we worked with the industry to create this request that's before you so that they can focus their resources generally on funding and recruitment and retention for their caregivers at long-term care facilities. We do understand the limitation that not all of these facilities are enrolled with Nevada Medicaid. If that is a condition of this committee that we should prioritize those individuals that are enrolled with Nevada Medicaid or make other conditions of participation, we would be happy to consider those. This is an area that we have struggled with because Nevada Medicaid would have to, the providers that are not enrolled with Nevada Medicaid would need to go through the controller's office to enroll in order for us to provide them with payment. But we would leave that suggestion to the committee if you do not feel that as an industry at large, there would be benefit in providing the supplemental payment.
Could you tell me, so there's two different types of providers here, the nursing facilities and then the assisted livings. With the nursing facilities, do you have an idea of how many of those licensed facilities do not take Medicaid patients?
Dr. Capurro, for the record, thank you for the question. Yes, we do. So we have 3 nursing facilities that are not enrolled with Nevada Medicaid.
And then the rest of them
are.
Okay, so vast majority are. And then same question on assisted livings. How many of them are taking Medicaid?
So according to our records, we have 207 that are not enrolled with Nevada Medicaid and 185 that are. So over half of the assisted living facilities are not enrolled with us.
I guess to me, the logic for me doesn't follow that the non-Medicaid facilities would get the supplement. And I think the workforce issues are legitimate, whether the facility takes Medicaid recipients or not. But we just know for those that do take Medicaid, we know more that because we pay the rate and what we reimburse them at, the state, there's kind of that direct correlation between what the state pays for their Medicaid rate and not covering the cost of care for the services that they provide. So to me, it would make a lot of sense to focus this on those that take the those that have Medicaid patients in or residents in their facility. And I don't know if there's a compelling reason for the facilities that are non-Medicaid to be part of this. The second thing is, and I appreciate, I've got here in the workup information from the association and really great numbers on the workforce and talking about the need to get more resource to the workforce. So as a legislator, am I sitting here with the expectation that the supplements will end up in the hands of the workforce? Or do we know more about how these dollars translate to what I'm being given about the ability to retain and keep and the wages of the workforce?
Melissa Lawfer-Lewis for the record. So once we make the supplemental payments to providers, unfortunately, we cannot mandate that any portion of that goes directly to staff increases, but we would, of course, recommend that. Okay. And so I support this. I really think that we need to focus on the Medicaid facilities exclusively, because then once the reimbursement comes and the supplement hits those facilities, in some way it will benefit the workforce, I imagine, because they've got so many Medicaid patients that they are servicing. So I feel like if we focus on just that Medicaid population, I'm less anxious about where do dollars flow, especially if they're flowing to purely privately run and managed organizations or corporations. Like I as a legislator don't have a right to necessarily tell them where to put that money if I don't give it to them, right? But where it's Medicaid, I feel like I know those dollars are going to end up being put to good use, because I don't think any of us here are going to argue with the fact that our Medicaid rates are so low and we don't cover cost. So I guess, Chair, I'd be happy to make a motion, but I guess within the motion, and maybe staff could help me, is there a way to distinguish that confirm with me that we have the discretion to do that, and if we have the discretion to do that, then how would I ensure that the motion...
Okay, and before you do that,
Yeah.
I believe we have some other comments.
Yeah.
But why don't we have staff answer that question? Is that a legal question? So can... Actually, did you hear the question?
We've got the work program in front of us, so do we have the discretion to say that the supplemental payments ought to only be for those with Medicaid, those facilities with Medicaid recipients?
And we're going to give you just a second, because I think Assemblyman Carlton had a question. And then we'll come back to that.
Thank you, and thank you, Mr. Chairman. So I'm trying to remember in my mind, I know Medicaid is a low payer. We hear that on a regular basis. Where is Medicare on the scheme? Because I'm thinking that a number of the ones that don't take Medicaid patients, I'm sure they all take Medicare. So at what level does Medicare pay? Does anyone know?
For the record, Melissa Lawfer-Lewis. So I don't know the Medicare rate off of the top of my head, but my understanding is that Medicare has a limitation of a number of days, but we can certainly get those details and follow up with the committee.
And the reasoning for my question, Mr. Chairman and committee, is because if the Medicare rate is close to the Medicaid rate, then that same impact will hit those other assisted living and nursing home entities. I understand wanting to give a supplemental payment, hoping that because of the workforce shortage, that these entities will use those dollars to raise the pay, to be able to incentivize people to come to work for them. I'm hoping that's what it would be. But there are some operators that may not happen with. And I know there's no way of us guaranteeing it, but we will be able to evaluate it in the future. I hope, and you can confirm this with me, that if we do give the supplemental payment to them, whether it actually did make it to the workforce or not. So I think this committee in the future is going to want an answer to that question. But to me, if Medicare is that close to Medicaid, if there isn't that big a payer difference, then there's still an impact. Thank you.
If I may, Melissa Loffer-Lewis for the record. So it is our intention to work with the industry to receive post-audit reports and verify what the funds were spent on so that we can report to this committee.
Thank you very much.
Thank you.
Dr. Titus.
Thank you, Mr. Chair. After 30 years as a long-term care medical director, I can say that Medicare doesn't pay for most assisted living needs. And so comparing them to Medicaid, it's not comparing apples to apples. So Medicare will pay for certain skilled levels and, as you mentioned, a certain amount of days, but it's a totally different issue when it comes to Medicaid paying for assisted living and patients that have been in long-term care literally for years. And so there's a distinct distinction there. So I don't think we can really use that as a comparison for what they reimburse for a skilled level versus an assisted level day.
Okay. That wasn't a question, that was a comment. Okay, thank you. All right, let's go back to someone with legal. Do you want to have legal?
Hi, this is Jessie Dunn with the LCB Legal Division. I think Brian Fernley is on the line now, and he might have wanted to answer this one.
Yeah, Mr. Fernley.
Yes, thank you. And I apologize. I heard the question, but could I be reminded of the question?
Sure. Someone, Benitez Thompson, would you?
Yeah,
restate?
Thank you so much. So the question is within we've got the work program in front of us as stated. The question is whether or not we have discretion in this committee through a motion to say that we authorize the contract for the supplemental payment to bring that person in and for there to be the payments and the full amount, or the amount that's being asked, the $15 million and such, but that the supplemental payment could only be directed towards those facilities that have Medicaid, either patients or residents, respectively.
Yes, I think that the IFC would have the authority to do that through a motion to condition approval of the work program on that condition. So I think that could be done through a motion.
Okay, we have a question, Senator Gansert.
Thank you, Mr. Chair. Since we're talking about this and how we do it, the way this was proposed, Lisa, how I read it, you were dividing it up between the different institutions versus a temporary rate increase per person, right? So if you say there's 5 institutions, one has 100, one has 200, one has 500, if it's block amounts dividing by the number 5 versus the head count of people, that makes a difference too. So just something to think about. Because in the scenario that you've presented, I believe everybody gets a like amount, no matter how many folks they serve, versus if it was a temporary increase per person per bed. Just a thought.
Okay.
For the record, Melissa Loffer-Lewis. So while our narrative does include the average, the actual payments would be based on the bed rate or the bed day rate increase.
Thank you. If I can continue. So going back to the bed day rate, under the proposal that Assemblywoman Benitez Thompson is suggesting, it almost seems like that should be limited to Medicaid patients versus all patients, but I guess that's a question for this committee. All patients versus just Medicaid if we're talking about trying to serve the Medicaid population. Thank you.
Mr. Whitley, or Director Whitley, would you chime in on this?
Sure. Director Richard Whitley for Department of Health and Human Services. I mean, first, just to back up a little, I think we're trying to address two problems with this work program. One is, as you probably know, during the pandemic, tough time getting people discharged from hospitals. Primarily, people are discharged from hospitals, if not to home, then to skilled nursing or assisted living. And so the inability of those facilities to hire staff does impact the flow within the healthcare system. The second part is, Medicaid is the primary payer for skilled nursing facilities, nursing homes, but you have to be eligible first, which means you have to pay out of pocket until you qualify for Medicaid. So I don't necessarily think that the marker of whether a facility may be taking Medicaid is an indicator of whether they will see people who maybe are struggling financially. I mean, it's not like other markets per se. I just feel the need to lay that out, that these are all licensed facilities, and they do sometimes take people that pay out of pocket, but they're pending Medicaid, or they may then be eligible for Medicaid. So it's a little different landscape, I think, with assisted living than in other healthcare providers.
So I think we could probably take it down to, because on the nursing level, the skilled nursing facility, all but 3 have Medicaid patients, right? So almost the entirety of that facility type is going to get the supplement, right? And I hear what you're saying, that even for those 3 that may not presently or generally or take like through the front door admit folks with Medicaid, at some point they might have people come Medicaid. I believe that. I think where I have more of the problem, and I guess less of an understanding or an appreciation, is on the assisted living side. We have 185 facilities that we know that have Medicaid patients and 207 that don't. So we're talking about this pot of money really being diluted if we have 207 assisted livings that don't have Medicaid patients getting a supplemental payment from Medicaid. That's where I feel more of the rub. I guess is that what you were talking about still true? Because as I know, the assisted livings, it's unless someone's in spend down, but we hypothetically don't have spend down. I mean, on paper spend down, but we've got families planning spend down. I just don't know how this gets Medicaid patients through the assisted living door.
For the record, Richard Whitley, I think, although managed in Medicaid, I don't think we were trying to enhance the Medicaid system or the provider network. We were really trying to address 2 challenges. One is the ability to safely and timely discharge people from hospitals to an appropriate setting. And then the second part of that is the workforce challenge that all industries are having. And we have a hard time placing vulnerable populations, whether they take Medicaid or not. And so the generalized approach of just trying to, and then as Dr. Capurro mentioned, we're likely going to try to recruit those as Medicaid providers. They're all licensed, so we all know they provide a standard of care. They're all inspected, but we also saw this internally as perhaps a tool to actually engage more of the providers through this relationship.
I appreciate that. I guess, and maybe and I see Miss Jeannie Bishop-Priest up here, so I know I'm about to get a stern talking to. Maybe I should couch it like this. That when you are thinking of that supplemental payment, and I imagine you're hiring someone and you're contracting someone to come up with what that payment will be, I think a consideration when you're looking at assisted livings are those that, I mean, there's a big community of assisted livings, those that charge north of $10,000 a month are completely private pay. And I know there's never going to be a Medicaid patient in there. I know it, right? Versus those assisted livings that are maybe charging $3,000, and then they will keep someone there on one of the waivers when they start to deplete funds and transition over. So there just has to be that distinction, right? I don't want the ones that are the private pay and that very high monthly fee. They don't need the Medicaid supplement. But if you see a space where there are some of those who don't take Medicaid that could take Medicaid, and you want to build them into that supplement, I guess okay. It's still just 207 who don't have Medicaid patients right now, and so I worry that we're diluting a payment when 185 assisted livings that really do take Medicaid, that more money could be focused towards them, and they're taking the patients.
This is Dr. Kapoor for the record. If I could just make a comment on that. I do think that there is value in providing payment across the industry, and having those non-Medicaid providers register with the state as a vendor can also help us start those conversations with them to hopefully become Medicaid providers. But I think this request is really about the delivery system support. And I think the comment perhaps about a tiered system of payment, more for higher payments for Medicaid patients or Medicaid facilities versus those that are not Medicaid providers, perhaps should be a consideration.
Okay, so where are we? Oh,
May
go
I
ahead.
indulge?
Yes, please.
The attention of the IFC. I am Jeannie Bishop Parise, BISHOP-Parise, PARISE. I was license number 156 for nursing facility administrators in the state of Nevada, signed by license number 2 and number 4. I have taken care of Nevada's vulnerable population since 1984, when I returned to the state from getting my training out of state. That's the only time that I've left the state. I am a Nevadan through and through, and I was my high school valedictorian. At a time when there weren't really scholarships available, I got the $1,000 Fleischman scholarship from my small high school. The healthcare treatment of our seniors has really evolved in the state since that time. But what you've seen is, when I was an administrator in the early 1980s, the reimbursement was, maybe half private pay, and the rate was $80 a day. And then the Medicaid program evolved, and the reimbursement structure, and it morphed to where now, really, in an skilled setting, it's, it's 250 plus ancillaries a day. And so that's very, very cost prohibitive. Now, I am license number 3 for the state of Nevada in what's called a health service executive position, where I actually can operate home and community-based services as well as assisted living. And where the assisted living has come in, and you've passed laws that allowed assisted living to do more care, and you push it down to the least restrictive level, to where we do diabetic management, where the person is stable and predictable. And we were the first, I think, in the state that did do diabetic management. And I read into the record an affidavit from one of the residents that was being forced to go to a skilled nursing facility long term. And that's not the desire of anybody. And so what you've seen with the skilled facilities is they really have the ones that are there because that's the only place that they can get care. We're pushing it down to the assisted living level. Now, I was one of, because I took care of one of Nevada's first AIDS residents, my company saw in me a resource. And so when COVID first broke out, I had a new administrator at our sister facility in Redmond Heights that had 2 employees that were also working at the Life Care that was national news in the first outbreak. And I worked with the state of Washington in returning our memory care to our assisted living up there that survived. We had 6 deaths and 10 that came back onto the unit. And we had to incur expenses in, higher grade products, getting that unit deep cleaned, and then restaging it so that there would not be another outbreak. And then we also had to have a sitter with each of those ones that returned after comprehensive care plan and oversight and release from the hospital that they wouldn't, infect anybody. And memory care, dementia, behavioral is a very, difficult group to provide services for. One of the other things that we did with the legislature here was we got a $3,500 a month rate for memory care for level 4 Medicaid. But the private assisted living, such as I operated for 10 years, really take advantage of, and they have the ones that maybe, only make $2,100, which puts them over the Medicaid rate. And then you add to that the Veterans Aid and Attendance benefit that's for them. And you can get the rate at about, $3,500. And so I don't think that those of us innovative private providers that have, and I was the only facility in the state of Nevada that won a National Quality Award in 2020. We've been incurring costs for COVID and keeping our population safe and not having outbreaks and deaths since the beginning of 2020. So I say that, the licensed beds, assisted living, do perform a service, and they do benefit the Medicaid pot of money because people can live out and stay with us. Even though we're not a Medicaid provider, some of us. Now, and I'm not saying that you should, give us $10,000 a month because that's not within our charge structure. But I think it's fair to say, okay, the nursing facility rate is, $250 a day. The average assisted living rate, I think our costs were $100 a day.
I need to cut you off for just a second.
$130.
Because we're getting a little off track here. We're trying to decide on this budget item, so we appreciate your comment. That's probably more appropriate for public comment, but so I need to get us back on track. So I don't know where we were at. I believe that Assemblywoman Benitez Thompson, were you? I think. Do we have any other questions? Because you were at the point of trying to make a motion, and I don't know if you've got enough information, or are you ready to do that?
Well, I guess I just want to check back with Mr. Whitley on the 207 assisted livings that don't have the Medicaid patients, and then we've got some idea of what's going to be happening, the workforce costs. I think Assemblywoman Carlton has the question out there too about how do we know that this goes down to the workforce cost, right? For me, I see more of a direct flow with the 185 assisted livings that take Medicaid patients. So I guess, do we make a distinction then for on the ones that the assisted livings that don't take the Medicaid patients for a better understanding of where these supplement dollars would flow for their workforce? Does that make more sense then?
For the record, Richard Whitley, Director for the Department of Health and Human Services. I think we could go back and develop a tiered program that would supplement those that don't take Medicaid less, and continue to incentivize them to enroll in Medicaid as a provider and work with them. But we could definitely develop a plan that includes a tiered system that would be inclusive, all licensed assisted living, but would have a distinction for those that accept Medicaid versus those that do not.
Okay, I think we have a plan here. Vice Chair Carlton, you want to attempt a motion?
So there seems to be a lot of questions, and we all want to be able to get the money to the right people and be able to support the folks that are supporting Nevadans who do take Medicaid. And Director Whitley, I like your idea of a stratified type system. I think what might work for the committee, just for us to think on, is to take this money and put it in a segregated or designated reserve within your budget. Go ahead and give it to you within your budget, set aside for this, and then you could come up with that stratified plan in order to be able to do it. That way we don't slow you down by making you come back in January, because I don't see an IFC in December, but I'm getting a look from staff, so that tells me that I need to slow my roll for just a second. But we want you to be able to use these dollars. We don't want to slow you down, but we also want to make sure those folks get out of the hospital, get into the proper facility. But we shouldn't be rewarding people who don't take our Medicaid patients. So we're trying to find a fine line here. So let me make sure that I have the language correct, and then so that you have an idea of where I think we need to try to go. So give us just a moment here. So to clarify, there is a position in here for $97,000, so that would go, we would process that, we would take the balance, put it in that designated reserve, and allow you to come up with this stratified plan to be able to reward the different, or to be able to use the supplemental payment system with the other entities. If that, and this is new to the committee, so I don't want to spring it on all of you, but it seems like there's a lot of unanswered questions, but the last thing I want to do is make you guys have to wait till January. This is too important to wait for that long. So, Mr. Chairman.
Okay, so was that in the form of a motion? Oh, well, actually, let me do this. So because we've had that discussion, any questions or any other thoughts before I take a motion? Senator Gansert.
Thank you, Mr. Chair. So I think that sounds reasonable. And what I was hearing is part of why you want to incentivize them is so they will register with the state as potential Medicaid providers in the future. And creating that connection is very useful, and having a tiered strategy makes sense to me. So I think that's something, and they need the personnel right away. So I would agree with that. Thank you.
Yeah, so this would allow us to move forward, and then you can and approve the money now, and then give you a chance to come back and tweak it. Okay, I'm not hearing any other questions, so I'll take a motion from Vice Chair Carlton.
So in references to items number 91, 92, and 93, I would move for approval of the $97,000 to go towards the staff cost, and the balance, and Mr. Thorley, if I get it wrong, and the balance go into a segregated reserve in order for the agency to use the dollars after a stratified plan has been developed, would be my motion. Just a second. $97,623.
Yeah.
We don't do cents anymore.
Yeah. All right. So we have a motion and a second from Senator Canizaro. Okay. Further discussion on the motion.
Ms. Beninas-Thompson, any comment? No?
Nope, that's good. Yep.
Okay. Any other discussion? Hearing none. All those in favor say aye. Aye. Any opposed say nay.
Aye.
Motion carries. Okay. All right. So. Okay, we'll now move to 9697.
Good afternoon, Chair Dennis and members of the committee. For the record, my name is Julie Ornelas, and I'm the Program Administrator for the Nevada Criminal Justice Information System Modernization Program. Also here with me today is the division's ASO, Jason Colnett. We are here to present the work program and answer any questions that you may have. This work program requests the addition of $20,853,829 in American Rescue Plan Act funds to continue the funding of the NCGIS Modernization Program for state fiscal years 24-25. With that, we will open it up for any questions you may have.
Okay, Senator Cannizzaro.
Thank you, Mr. Chair. So the modernization project had, as part of it, the fee increase for civil applicants doing a fingerprint-based criminal history background check. It's $3.50, not $350. $3.50. And so my question is, if these ARPA funds are approved for this modernization project, will the agency continue to charge that additional $3.50 for civil applicant fingerprint background check fees, or would this money sort of take the place of that, and so you wouldn't be charging that fee any longer?
For the record, Jason Colnett, with this funding being available in FY24, it would stay in place during the FY23 year, and we would revisit it during the legislative session. We have found that we are bringing in less revenue in certain revenue GLs and court assessments especially. We are projected to be down about $1.5 million this year, and so we would like to revisit that during the upcoming session.
Okay, so that sounds like something that you're still looking into, but overall that fee had generated less than anticipated originally anyway.
For the record, Jason Collins, that's correct.
Okay. The next question I had was related to the position. So once this modernization project is completed, how do you continue funding those ongoing state positions that are currently going to be funded with the ARPA dollars?
Okay, thank you. For the record, this is Julie Ornelas. The NCGIS Modernization Program staffing structure consists of 8 FTEs, 8 contracted staff, and 3 consultants. The program is scheduled to end on June 30, 2025. And once the modernization program is complete, service for the contracted staff and consultant team members will end. However, there will be a need to carry forward some or all of the FTE positions. The plan and structure for the FTEs beyond the modernization will be addressed in FY 26-27 budget.
Okay. Any other questions? Yeah. So, and I'm just going to ask the question that we asked that we've been asking everybody on these projects. It looks like you have $20.9 million that's set aside, but not for the current fiscal year, but for the future. Is that correct?
For the record, Jason Collins, yes, that's correct.
And if we did this similar that we've done with the previous ones, put it in a special category, reserve category, so that you could then do a work program to expend that at that point, is there any issues with you as far as doing that?
For the record, Jason Collins, not at all. That'd be perfectly okay.
Okay, thank you. Any other questions on this item?
Mr. Chairman,
Carlton.
Thank you. Mr. Chairman, I'm sorry. I guess I got a little bit confused about the $3.50 fee. The civil applicant fingerprint background check fees, probably being one of the few people in here that's been fingerprinted so I can serve Bloody Marys and club sandwiches. Just kind of curious about whether that $3.50 is going to stay, going to go. Have you not decided yet? What's the plan? And if I missed it, I apologize.
For the record, Jason Colnett, it is something that we will do an analysis of and revisit during the session because the money is not available to us until July 1, 2023, which is fiscal year 24. That $3.50 we plan on keeping in place until the end of fiscal year 23. So during the upcoming session, we will provide an analysis of the increased fees and where our reserves stand and present it at that
Thank
time.
you. It's much clearer now. Thank you very much. It's been a long day. I'm going to need to hear things 2 or 3 times before they sink in. So thank you very much.
Right, thank you. Any other questions? If not, Senator Carlton.
So this is going to sound familiar. I would move that $20.9 million be moved into a reserve account and have the agency come forward to request it in the future. Does that cover our bases, Mr. Thorley?
Yeah.
Okay, that would be my motion.
Okay, we have a motion, a second from Senator Cannizzaro. Further discussion on the motion. All in favor say aye.
Aye.
Any opposed say nay. Motion carries. Okay, we're going to go to 110 and 111. Yeah, we're going to go straight to questions. This one was requested from Assemblywoman Benitez Thompson.
Thank you so much. This is just, and thank you for coming up. It's kind of a question, and it's more meant to be about the language that's within the, it looks like the scope of budget for the actuarial. And so I know we very much need this. This is the provider tax and then the reassessment back out is going to be very important. This is good work. I just got nervous because in some places Mercer is really qualifying some of their deliverables. And so I just kind of wanted on the record that this is something that I know you guys will obviously be watching, but the legislators on the panel also watch as well, because this is one of those longer contracts. All of the bullet points for deliverables in 23, 24, and 25 look almost identical. You know, they talk about, you know, there being a lot of uncertainty, so things in the budget might need to move around. Adjustments are going to be made as needed, and, you know, the scope might change and things are going to evolve. And so it felt a little squishy to me, and I guess I just needed to hear reassurance from you that you're having good conversations with the contract vendor. There seems to be very much a solid plan moving forward, and I shouldn't be worried about this at all, I guess is what I want to hear.
For the record, Melissa Lawfer-Lewis. So just to start, so this is a major...
Can you pull your mic down just a little? There.
Sorry. Better. This is a major initiative. I mean, we got authority for this particular program through the legislature several years ago. And so we have been working diligently with the hospitals to come up with a program. As we've continued those conversations and got a semi-formal approval vote, we have begun looking at what the process is to actually implement this project. And so we really need technical assistance from our actuary because there's two different sides of the house. One is payments will be released via for our fee-for-service population, which are going to be supplemental payments. And then we've got our managed care side of the house that requires a state-directed payment, all of which gets approved through CMS. So while I understand the deliverables, using your words, sounds squishy. Really, there's so many unknowns as we go into these negotiations with the hospitals and being able to validate, okay, we have initial estimates from the hospitals of certain dollars. What that ends up being in terms of payments and taxes is likely going to change, and we want to make sure that we have the technical assistance to be able to create a solid program that will be approved by the feds moving forward.
Thank you so much. And the Hospital Association, it looks like, has their own consultant helping them with this project. And so the Mercer, I guess, they're being hired by the state, and this is to make sure that the state has the assistance and resources they need as they move forward with this project, right? This is kind of our guy in the conversation, if you will.
Melissa Lawfer-Lewis, for the record, that is correct.
Okay. All right. Thanks.
Other questions? Someone, Benitez Thompson, you want to make a motion?
Yeah, I would move to approve items number 110 and 111.
Assemblywoman Benitez Thompson has made a motion. We have a second from Senator Canizaro. Further discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Any opposed say nay. Motion carries. Well, no. Okay, we're going to 112 and 113.
Good afternoon, Dr. Cindy Pitlock, Administrator, Division of Child and Family Services. To Chair Dennis, would you like just a brief one paragraph, or would you like to roll straight to questions? Your pleasure.
Yeah, brief in capitals with the underline.
Okay. And thank you for that. I understand. Excuse me. This request will be subawarded to the Vegas Strong Resiliency Center for capital improvements to improve and increase services for Nevada's victims. It will also fund temporary staff, a project manager, and associated expenses through December 2026. The center currently exists to address trauma and respond to and prevent violence, but needs to be scaled to meet the increasing needs of the community. If funded, the center will provide a high-quality, professional one-stop shop for victims to receive wraparound support provided by the people and organization who were awarded the 2021 National Crime Victims Service Award from the Office for Victims of Crime. I am thrilled to have the director of the Vegas Strong Resiliency Center here with me, Ms. Tenille Pereira, to answer questions about her project.
Welcome.
Thank you. Good afternoon, Chair, members of the committee. I will ask also, do you want the spiel or do you want just questions?
I think we could, let's get to the questions. It'll probably what you're going to cover is probably going to be covered there. So, Assemblyman Roberts.
Thank you, Chair. And I really enjoy your work. The stuff that you do there is phenomenal, and certainly support everything that you're doing and want to get you in a permanent home. My question is, and it's a total for the project is almost $17.5 million. The ask by the state, $7 million, and then the federal government's pitching in some, and then there were some pledges or monies needed by Clark County and the city. Can you tell us where we are on those?
Yes, Tenille Pereira for the record. So those two other from the city of Las Vegas as well as Clark County didn't come through. And so those are not there. So we're going to continue to look for other ways to fill those gaps, most likely philanthropy.
Okay, and so just another follow-up is if you don't get the additional monies, then what do you do? What do you do with the project? So now we're going to be relying on how much money is that? It's like almost $10 million from philanthropic needs. And so do you think we can fill it? And if you don't, then what's the alternative?
Tanil Pereira, for the record, we feel very confident that we will raise the funds that are needed for the full scope of the building that has been proposed. If we didn't get that amount, we do have, through legal aid. So we're managed and operated through the Legal Aid Center of Southern Nevada. For just an example, our main building has no mortgage on it. They raised the funds for that through philanthropy as well. So we feel very confident we will raise it. However, if we don't, we have looked at other options, and we feel very confident, and we are committed to this project.
Okay, thanks. One last question, Chair. So who would be responsible for awarding the construction contract for the project, as well as who's responsible for overseeing that? Is that something that your center is going to do? Is that somebody else, or it's the state's responsibility?
So I believe there's funding in the request for project management, but to be clear also, we do have experience in that. Our chief financial officer has already overseen the building of our main legal aid building, as well as some build-outs, some very complicated ones with government. So I feel very confident we have the expertise for that, but I will turn it over to Dr. Pitlock.
Okay.
Thank you for the question, Assemblyman Roberts. Yes, embedded in the request is for us to have a project manager to help us manage this, because frankly, we don't have that type of experience. So we have set ourselves up for success in that manner.
Got it. Thank you. And one last, so you wouldn't start until you secured the rest of the funding, or would you start some of the planning and design work or whatever on the front end, or would you wait?
Tanil Pereira, for the record, thank you for that question. We've actually started looking at it. We have designs that have been presented to us, looking at what would fit the need best. Our architect is Craig Galati. He did our last building as well, and we have already started working also with HUD for the $3 million appropriation through the federal government. So, we're going to get started right away.
Okay. Thank you. Thank you, Chair. I don't know what your mood is on moving forward with this or not.
All right. Thank you. Let's see what other questions. Yeah. Assemblyman Carlton.
So is it my understanding then that this money will get you started? You're going to go ahead and start with these dollars? You said something about getting started, so I just wanted to find out.
Tanil Pereira, for the record, thank you for the question. I will clarify. So right now we have a $3 million federal appropriation, and we have begun the process with HUD on that appropriation. This would put us at about, 9.5. So we're going to be moving forward. If we're looking, as we look to other philanthropy for those funds or to other assets that legal aid already has, then we'll do that. But we're not going to stall the project for that remaining piece, if that makes sense.
And thank you, Mr. Chairman. And, I echo Assemblyman Roberts' comments, where we're all very supportive, but typically how the committee processes these things is we would set the money aside, have you go raise the money, and then come back to us and say, okay, here we are, can we have that? And by setting the money aside for you, it allows you to go to the other funders and say, hey, listen, the state is in for $7 million, now I need you to be there also, because typically the state is the last dollar in on these projects. So would that complicate things for you if we proceeded in that structure that we would normally use for a program like this?
Tanil Pereira, for the record. So the way that would work then is it would be set aside. Some of the previous ones I've been listening to today, I don't believe so. It would be dedicated to the project, correct?
Correct.
I don't think so.
Because, and committee and Mr. Chairman, that's typically how we've done it in the past, is we've okayed the dollars, set them aside, had you go raise a portion of that, come back and say, we've raised this, do a work program, have it come back, and then we would go from there. So in the vein of all the other programs that we've done today, that's would be where I would be leaning at this time, knowing that you can use this $7 million of state money to convince other folks that they can come up and match it also. So that's where I would be leaning, Mr. Chairman, knowing full well that we are very, very supportive of the project. We just want to do this the right way.
Right, and as was mentioned earlier with the other, you would just come back with a work program, working through the governor and finance office, to then request the funds. So they would be dedicated to you, and you just have to come back and, once you have that.
For the record, Cindy Pitlock, if that is the pleasure of the committee, we would certainly be able to manage that.
Okay. All right. Any other discussion or questions? Don't see any. Madam Vice Chair, you want to? Oh, I'm sorry. Senator Roberts.
Yeah, thanks, Chair. That would be my motion, is to move forward, put it in a reserve account, have them come back. If it's not going to complicate their project, then be more supportive, more than ever supportive.
Okay, so we have a motion from Senator Roberts, a second from Senator Cannizzaro. Further discussion on the motion? Yes. Senator Yeager.
Thank you, Mr. Chair. And I'll be quick. I just wanted to recognize the work done by the Resiliency Center. And if you haven't had a chance to go there when you're in Southern Nevada, you should definitely stop in. And, now that we just passed the 5-year anniversary of October 1, I'm excited about this project. I think the vision for this space and where it's going to be located is just going to be something amazing. They do amazing work in the space they're in now, but it's in a very busy area off of Charleston, and I think this project is really exciting, and it's going to help support those impacted by that tragedy for years to come. So just wanted to take that opportunity to thank you for the work you're doing.
Thank you.
All right. Yes. Assemblywoman Titus.
Thank you, Mr. Chair, for the question. I definitely appreciate what you've done and what you're planning to do in the future. It's a kind of a long-term, you don't get over this situation like this in a day. My question is, do you still have relationships with the visitors that were not in the state of Nevada? This is one concrete location, and will any, besides the building itself, any of the money being spent to reach all of those folks who came from out of state?
Tanil Pereira, for the record, I appreciate the question. We are still connecting with people all over the world from this tragedy. We're still hearing on at least a weekly basis from individuals that have never been connected with our services because they didn't live in the area. We connected with so many people over this 5-year remembrance, and it was just, eye-opening. It's always eye-opening for us. We continue to be, just, I won't say alarmed, but noticeably in awe of the impact from this horrible tragedy. So we will continue to be there, and that's one of the pieces of this. We wanted to have something permanent for all of Nevada, for whether there's a mass violence incident or it's just a regular violent victimization from someone in the state, that they get those wraparound support services, but also recognizing that, that mass incident was so horribly impactful that we need to be here long term and not just when the federal grant runs out.
Okay. So let's come back to the motion. Any further discussion on the motion? Hearing none, all those in favor say aye. Aye. Any opposed say nay. Motion carries. Thank you very much.
Thank you.
Okay, we will now go to 131 and 130 and 131.
Good afternoon, Chair Dennis. Oh, my apologies.
Hey, go ahead.
Good afternoon, Chair Dennis, and to the committee. Thank you for the opportunity to speak on this matter for consideration today. For the record, my name is Erica Roth, Deputy General Counsel to Governor Sisolak. The governor is committed to ensuring the state of Nevada has a comprehensive continuum of care for mental health services across the state. As part of that commitment, the governor has worked with the Department of Health and Human Services and all interested parties, including the Nevada Supreme Court, courts across the state, public defenders from across the state, and district attorneys. Together, we've identified a long-term solution to the long-standing and increasing need for forensic bed capacity, which provides complex psychiatric care and treatment. What you have before you today reflects that work. As you know, the state of Nevada is a provider of these services pursuant to NRS 178.425. Not only does this project provide the fastest, safest, and largest increase in access to services to individuals in need of the complex care, but this project also aligns with the governor's commitment to increasing the state's mental health infrastructure to ensure safe and healthy communities across the state. If approved, the state will repurpose a secure private building to create an additional licensed forensic psychiatric hospital in southern Nevada. This will be a standalone building licensed by the state, and workforce will be under the supervision of HHS. The increase in availability of treatment will reduce wait lists in our legal system across the state and support public safety and communities. With me to help answer questions today, any regarding this proposal, are Bailey Bordelin, our Deputy Chief of Staff to the Governor, and Lisa Sherich, Administrator of the Division of Public and Behavioral Health.
Okay, we're going to start with the Assemblyman C.H. Miller.
Thank you, Chair. I have a couple of questions here. First of all, can you clarify who would be responsible for the oversight and management of renovating the City of Las Vegas Detention Center? That's where it'll be, correct?
Correct. It will be in a standalone building on the campus of the Las Vegas City Jail, not the Clark County Detention Center. I would turn to Lisa, Ms. Sherich, regarding the renovations.
Good afternoon, Lisa Sherrick, Administrator for the Division. So it would be the State Public Works Division through the state that would be managing and overseeing the construction of the project under an agency agreement with DHHS.
Okay. So the state will oversee the actual project?
Lisa Sherrick, that is correct.
Okay, good deal. Thank you. What is the anticipated building lease expenditure for this to acquire the space?
Bailey Bordelin, for the record. We have been working with the City of Las Vegas on general behavioral health concerns, and I think you'll see that on the next items as well, that just in order to increase access to services, there's been a real healthy partnership there. And in that spirit, the City of Las Vegas has offered a 50-year no-cost lease to allow us to provide these services to the community. I say that with a lot of gratitude because the distinction is important that the City of Las Vegas jail is for misdemeanors, so this isn't necessarily an obligation they have to provide. Typically, the population that is served here is the responsibility of the county, and then this service itself is the responsibility of the state.
Okay. And the work program doesn't include funding for rent and expenses or anything because it's a no-cost lease. Perfect. Thank you. And then my next question is about the staffing. How many? There's about 115 staff members that we're anticipating, correct? Okay. So what's the, with the current rate of vacancies right now, how does the agency plan to fill these roles with qualified workforce and a diverse qualified workforce?
Lisa Sherrick, for the record. So I just wanted to first preface it with our state-ran hospitals typically have vacancies. Even back to 2020, we were in the low 20%, so we are a little higher now. So it's not unusual for us to have vacancies. So what we focus on is job fairs. I also, for the bulk of the staff that we look at for these hospitals, are mental health technicians and forensic specialists. The requirements for those staff is high school and 1 to 2 years of experience, like general work experience. So we're working to target high schools, higher education as well. We've been very successful lately using Indeed. And we've had a 25% increase in interest in various positions that we post that way. And we also have determined that the title of forensic specialist can be, I think, difficult for people to wrap their heads around what that means. So we're more thoughtful in how we're labeling that, and that's increased interest. We do use salary savings to cover or to move it into contracts. So we have a blend of contract staff and state FTEs.
Okay, and we're doing the necessary, we'll be doing the necessary outreach to ensure that those are it's also diverse employees in this, filling these roles, diverse individuals.
Yes, Lisa Sherrick for the record. We have a lot of efforts underway. I will say, especially in Las Vegas, Southern Nevada Adult Mental Health Services, which is where our 2 hospitals fall under, and then the licenses for these additional beds will also be under that. We have a very diverse workforce from not just the mental health techs, but through our psychiatrists, psychologists, nurses, et cetera.
Okay, and one last question. So for these 115 new positions, we're going to need more than the 15 million post 2027. Is that correct?
So Lisa Sherrick for the record. Yes, the plan would be is that we would look to put this into our agency request for the coming sessions after this, this funding runs out to continue those much needed services.
Okay, I think that's it for me. Thank you.
Okay, thank you. Senator Gansert.
Thank you, Mr. Chair. In looking at this, there was about $9.6 million that was capital, and the rest was ongoing. Not all ongoing. I think you had 123 positions, maybe 123 and 115 were ongoing. And so what we've done with some of the other projects that have come today, if the ongoing costs are in out years, so they're not during this biennium, but they're potentially in the next biennium, we've been able to put those into reserve accounts. And I think this is a significant program for the state as a whole, and that we might want to consider doing something like that in this case as well. Normally during a regular session, we would probably discuss this, at length, and we're in an interim finance committee meeting, and we're looking at ongoing expenses for 115 employees. And so I think we need to consider that and how we want to commit or make sure that it's rolled. And I think you mentioned that would be rolled into the executive budget for the next biennium. Thank you.
So can you clarify, have we ever done this kind of thing before? I mean, have we actually had a forensic facility that we've managed?
So Lisa Sherrick for the record. We have been providing forensic psychiatric services for, I think, about since the 70s. So we have had expanded beds a couple times. So I believe the first was 2007. We added an additional beds in the north within our Deanie Townsend Civil Psychiatric Hospital. And then again in 2015 of what we refer to as Stein Hospital, which was built back in the 70s as a civil bed facility. So yes, we've been in the business for a number of years for the state of Nevada.
So this is just a big expansion of what you've been doing.
Lisa Sherrick for the record. Yes, this is adding additional beds to meet the capacity needs for individuals that are waiting in jail for these restoration services longer than what we believe is appropriate.
Go ahead.
Erica Roth for the record. I'll add that the state of Nevada has entered into 2 previous consent decrees, one in 2005 and one in 2014, which completed in 2015. And the issue raised was the wait times for treatment to competency in our state licensed forensic facilities. As the population grows and there are national trends towards increased need for forensic facilities, the state of Nevada is again in a position where this is at a critical point. The governor has been very forward-thinking on this issue, but there is a long history with the state with both providing that service and also there is a need at this point to be forward-thinking and to understand where we're going.
Okay, so then we just had that discussion about that, the project is going to take a little bit to get built. So you obviously need money to be able to do that. But the people that are going to fill it, you're not going to need those until you until you get the facility completed.
Bailey Bordelin for the record. I will let the administrator speak to this as well, but part of the issue is this is a problem that we should have solved a long time ago, and we've never had the financial ability to solve it. So we have worked really closely with our court systems because this impacts them every day, and there's a real acknowledgement in our conversations that this is something that the state has a legal obligation to provide and provide in a timely fashion. So when the plan you have before you today is the fastest way that we can expand access to a service that the state is statutorily obligated to provide in a quick time frame, and currently there are hundreds of people on wait lists that we have a statutory obligation to serve and to serve quickly. So the plan provides for a building that already exists because we don't have time to build a new building. And it also provides for staffing that as quickly as we can so that the moment that we are able to get in there, we have already trained them, we have already hired, and we have the ability to hit the ground running. And that is good for not only the community and the public safety and the services that we provide, but the state's responsibilities and legal liability as well.
Go ahead.
Lisa Sherrick for the record. While I don't anticipate needing the entire 115 staff, obviously, until this space is renovated, there will be a need for some of those staff as we have kind of reformatted some of our civil space at Ross and Neal, and with the acuity of the individuals that come to us, and just I understand maybe many times people don't really understand what this truly means, but these are individuals with gross misdemeanors, felony battery, attempted murder, things like that. So it really is important that we have the right staffing mix. And due to the criticalness of staffing up some beds and reducing some civil beds, we have put together our civil staff with our forensics. So it would be more ideal if we could access some of these staffing dollars to be able to augment more forensic staff positions that we don't currently have the ability to do so.
Okay, so then just so I'm clear, in this discussion, so if we funded the construction costs, and you're anticipating, was it 26 that this would? I mean, when would the construction be done? Because the building is there, so you're just remodeling the building, right?
That's correct. The initial estimate was for spring.
Just make sure you identify
I'm
yourself.
sorry, Erica Roth for the record.
Thanks.
The initial estimate was for spring of 2023, so it is very quick.
Okay.
We can't guarantee that will happen. There are obvious delays, but we are hoping that this will be at least partially renovated and ready to be used by at least July of 2023. So there is an immediate turnaround that we're working on.
So then you would need to start hiring fairly soon, or I mean, if it's going to be that quick, right?
And Lisa Sherrick for the record, yes, if we can do July 1st, which would be amazing if not sooner. Just the process of onboarding recruitment can take several months, so being able to do that prior to July 1 would be very important.
Okay. Assemblyman Tolles.
Thank you, Chair. And I just wanted to clarify something. Earlier, you had said that you were going to be recruiting among high schoolers or just post-high school, and then could you differentiate between civil and forensic staff, and given the population that they would be dealing with, what positions those youngsters would be filling?
Lisa Sherrick for the record. So our forensic psychiatric hospitals have forensic specialists, and they are required to have high school graduation, a GED or high school diploma, as well as 2 years experience. One general, one could be college courses or a combination. As well, the forensic specialists also are required to be post-trained, so the Peace Officer Academy, CAT 3. For our civil side, we have mental health technicians, also requires a high school diploma or GED. They're not required to do the post-training. Both, the focus is that mental health training that we provide, and there's college courses that they have to take to get a certification within our organization. And it's really primarily many of the same tasks outside of with the forensics, since they're still under the authority of the jails when they come to us. Having that peace officer training is really ideal for that piece. I hope that answered your question, but we do have young people that apply. They do get a minimum, 40 hours onboarding. We have those classes that they're required to take. There's a progression for them to go, from a mental health technician 1 to a 3, and then maybe a 4 as a supervisor. Same with the forensic specialists.
Okay, thank you for clarifying. I think I just misheard you because I thought I heard that you were recruiting in the high schools for that position, and maybe I just misheard you, but that helps me understand a little better what the requirements are and the additional education, training, certification, not that we're
Lisa Sherrick.
And I apologize. It's a long day, and I might have just misheard you.
Graduated. As they're graduating, it's good to get the word out. This is an opportunity to consider working for the state. Benefits, a great field, working supporting people with mental illness. So, yes, we're not targeting 14, 15-year-olds or anyone that's not going to graduate.
Thank you. And I do agree that we do need to start those career pathways early, and I think that's very important to fill that pipeline. I just wanted to make sure that was clear. Thank you.
Okay. So I need to clarify some information, because the information that you originally gave us told us that you were going to take up to 36 months to get the construction done, and you just testified it was only 6 months, so there's that's a huge difference.
Lisa Sherrick for the record. Ideally, we would love 6 months. If something changes with how things are going as far as getting contracts in place and construction companies, so forth. But there is a range. So it's 18 up to 36 months. But that is really just based on the information that we have right now. Things could change, but our goal is to see if we can expedite that as quickly as possible. That was just an estimate given to us. No, that was our goal.
Yeah, Bailey Bordelin for the record. I would just add to that, there's been some back and forth with State Public Works, and we are working really closely with them to identify how quickly we can get this project done, because it is a critical need. So we will aim to do this as fast as we can.
Okay. So that was the other question, and I have Vice Chair Carlton ask about the Public Works issue.
And thank you, Mr. Chairman. So this is not a state-run will be a state-run facility, but it won't be a state facility, so it really won't be under the operation of or maintenance of Public Works. Is that correct? Because we're getting a little confused with the Public Works combination here.
Lisa Sherrick for the record. We've been able to confirm that even though we will be leasing the space, because that was a little confusing in the beginning, State Public Works has verified that they will be able to provide the oversight of the work that will be done, and we will be doing an agreement with them, like a formal agreement, so they will take on that responsibility for us since they are the experts. We're the clinical healthcare type people, not construction type. So we will be working together with them on that.
And unfortunately, we have some conflicting information on that. Now, I'm not sure, have these negotiations been ongoing? Could we possibly have old information? Just want to make sure that we're all on the same page, because I know you were negotiating this.
We have had extensive discussions regarding this, and as of yesterday, we had confirmation that Public Works was informed by their Attorney General, their DAG, and I apologize, Erica Roth for the record, that they have been informed that there is a path forward.
Thank you. And that's we had one response. You were giving us another, but we know it was an ongoing process. So I think one of the things that kind of weighs on me is giving you this many employees up front is difficult, because we know the building's not going to be done for a while, but yet we're going to be designating all these employees. But knowing full well that it could take you 6 to 9 months to gear up on employees, and also knowing that there's threats of legal action if we don't act quickly in the state. So I'm a bit conflicted on how far we need to go, but I do know that we need to show a good faith effort as the state that we're willing to address this problem. And I think you've done a good job in finding a space and renovating it, because building a building is crazy. Are the full 115 positions needed right now at this time? Or I'm not sure if we would want to put the full 115 in a reserve and have you come back, or just try to split it, because I know you want to start hiring literally as soon as you can, because it's going to take as long to hire as it is going to renovate, in my mind, especially if you have to have people go through post, because there's only so many classes a year. So if you had to boil it down to the positions that you really needed, is 115 the number that you absolutely need right now?
Bailey Bordelin for the record. I will let the administrator weigh in on this as well, but I would say having as much authority as possible puts us in the best situation to succeed. And should we not be able to use all of it, we won't have authority to use it in any other way. So we will come back and revisit this and make sure that the dollars are used responsibly. But I would really urge you that this is one of the most important things we can do today. And having as much authority as we can to be as successful as possible in this space is incredibly important, because we can only open as many beds as we have staff for. And so while 115 may be optimistic, it is better for the community and for the legal system and for the state of Nevada to be able to aim for opening all of the beds as quickly as we can and have that existing authority. And should we not be able to expend it for any reason, we will not use it in any other way.
Thank you very much.
Other questions? Senator Goicoechea.
Thank you. And I'm getting a little more confused all the time here. But, okay, we're talking about 115 employees. And now we're going to push them out to clear out to 27 in the original proposal. Correct me anytime I get wrong here. But I'm still doing the same thing as we did with water resources and everywhere else. Okay, we need to have an executive budget from 23 going forward. And I recognize the need and the ability to hire these people. But again, we can't walk in here. We have to be able to deal with this budget next session and then push it forward and say, okay, this is what we can afford. 115 employees, okay, it's going to cost $15 million, and we have to book it. So correct me where I'm missing this. I'm fine with this as long as we can go to an executive budget for 23, 24 biennium.
Apologies, Senator, I didn't mean to speak over you. Bailey Bordelin for the record. Where this is different is that this is not about what the state can afford. This is about what the state has a legal obligation to provide. So we have to find a way to pay for this. And it is fortunate for us that we have an opportunity to use dollars that are not in the general fund, but you have a commitment from the governor that there is a recognition that this is an ongoing expense and an ongoing expense that we have a legal obligation to comply with. So to the extent that this is an opportunity to not burden the general fund, as has happened in past years when the state has not been on the right side of these lawsuits, this is a better way to spend the dollars than to be in litigation, because these dollars will serve the community and serve people in need.
A follow-up, if I may, and I appreciate that. But again, whether these ARPA dollars will still be here, we can hold them in reserve. But again, I want to make sure that we're not saying, okay, we're going to plug this in, and then we hit the end of the ARPA dollars, and then in the 27th session, they've got to come up with the 15. At that point, it'll be 25 million. I'm all about letting the legislature do its job going forward. Reserve it, whatever we do. But the bottom line is, we have to deal with this and create a budget for 23, 24, wherever the money's coming from. And again, you said it, the state has the obligation. We're required to bring this. And if we don't bring it out of ARPA dollars, it has to come out of general fund. So it's up to the next session of the legislature to figure out how we're going to do it, what money we're going to use. But please, I'm all about hire the people you need and the short term reserve it, but we have to be creating an executive budget in the end. Thank you.
Bailey Bordelin for the record. I would just add, I think it's fiscally responsible to have a spending plan that proves that we can, for the foreseeable future, responsibly see through the commitment of standing up a new hospital, so that we don't just stand it up and not have a plan to continue it, which is why we have provided thorough spending plans. There's an immediate need today. We'll start today, but we also have an obligation to show our work that we have an ability to be successful down the road. But you want to add to that?
Lisa Sherrick for the record. And I apologize, it is getting late in the day and I always get confused with my fiscal years. However, since these dollars, the ARPA dollars, go through December of 2026, there wouldn't be a need to put it in our budget this year, like for this session, but the following session, yes. That would be a priority of this division, is to make sure it's in the agency request to continue the positions, because the last thing that we want is to open up additional beds knowing that they will still have a need. There's a need in the community, and to then not have the staff to continue.
I really appreciate that, but again, whether we do it in 23 or 25, again, it is the legislature's duty to come up with that money, and I think it's fiscally responsible. We're spending money in a lot of directions, but again, we have to plan for the future, and a $15 million hit is going to be, it'll be 20 by the time we get to 25, and yeah, we need to fund it. I agree. I just want to make sure we're giving the legislature the ability to do their job. And I won't be here after this next session. Thank you.
Mr. Chair.
Yes, Senator Gansert.
Thank you, Mr. Chair. So I just had one other comment. Kind of going back to the construction plan, what we have is 18 to 36 months. And you may need some people in the near future because you want to move some people around, which I think is completely reasonable. But if the bulk, if not all those 115, because I think there were 123 spots, there were some that were contracted employees, definitely will be something, if we're consistent with what we've done with everything else today, that we've rolled into a reserve account to make sure that it's in the executive branch budget. So it's not that we're not saying we don't support this project. We're saying the process, for the most part, has been dictated that we roll these funds into an executive budget, except for the capital. And again, the renovation, the construction work that you want to do, it's been made clear that it's going to take 18 to 36 months, but also when it's a public works project, if you're going with public works, if some of us who've been here for quite a while, public works takes some time with the RFP and all the process that will be required even to get started. So I just think we need to consider that and consider some of the actions that we've done today, and also the magnitude of the commitment, which is very unusual for an interim committee to do as far as, the type of money and ongoing expenses. And my colleague, Senator Gokichi, has made some of those points already. Thank you.
Bailey Bordelin, for the record, I just want to clarify, we don't believe that the estimate today is 18 to 36 months. We believe that that is old information and that we will be able to secure a faster timeline with Public Works and that we will be prioritizing this project because of the nature and importance of this project. So again, I would really urge you to allow us to have the authority that as quickly as we can get this ready to go, that we are able to get ready to serve the community and to have people trained and in our workforce and ready to start the very first day that we can open the facility.
Assemblyman Yeager.
Thank you, Mr. Chair. And, I appreciate the comments, but I think the difference on this item is the state's potential legal exposure here. We didn't have that exposure with the other items that we're talking about. And, the state has already been sanctioned by a judge for these wait lists and not being able to get people in. That's an ongoing cost to the state. And so while I realize the concerns, I think for the state to put a good faith effort forward to be able to potentially defend against litigation and honestly to defend against judges who want to sanction the state now for the wait list, I think approving the item as given shows that good faith effort that we're doing everything we can to solve this problem, which admittedly is a decades-long problem that should have been solved years ago. But I don't agree with putting it in a reserve account because I think there's strings attached to that. They have to come back for those positions. We want the state to be as strong as possible to say we are doing everything in our power to make sure we're trying to address this obligation that we have so we limit legal exposure. So, for that reason, I am in support of the item as presented, realizing it's unique and not something that this committee normally does, but the legal aspect makes it worthwhile to me.
Yeah, Senator Gokichi.
Thank you. And I'm just along those lines, and I'm definitely supportive of it, and I want to ensure the state doesn't have the exposure. But, okay, let's say we go ahead and we approve this action. What stops the legislature from coming back and creating the budget and then, capturing this money? Because technically, even though it's committed, it hasn't been expended, and capturing it and then writing the budget moving forward. I don't think we can commit the next legislative session.
Mr. Chair, I would make a motion if you'd like.
Yeah, I think we're at a point now. I think we've had enough discussion. Go ahead.
Mr. Chair, if you would accept it, I would make a motion to approve D130 and D131. Is that the right one?
Is that right? Okay, so we have a motion D130 and 131. We have a second from Senator Cannizzaro. Discussion on the motion. Senator.
Yes, thank you, Mr. Chair. I will support the motion because I believe in the need, but I also believe that the legislature can probably pull this back when they go to session.
Senator Gansert.
Thank you, Mr. Chair. I'm also going to support this, but what I would like, I think we have an interim finance committee in December. We usually have one sometime in January. I think it's important for us to get some accountability as far as how the construction project is going and the positions that are being filled. So I'd like some accountability since right now it doesn't look like we're going to put it into an executive budget. I think that we need to add that to see what this timeline becomes. Thank you.
Do we have any other discussion?
Chair, I know I'm not allowed to speak right now, but GFO would like to offer a clarification that they believe this is already an executive budget account.
Okay, hold on one second. Because we are in the middle of a motion, but to clarify, because this just came up, and I'm going to allow that you clarify that just so that we're clear on that issue.
For the record, Robin Hager, Deputy Director with GFO.
Just for clarification purposes, this work program is going into budget account 3161, which is currently an executive budget account. You will continue to see it through the entire budgeting process as part of the governor's recommended budget in an executive budget account.
Great. Thank you. I think that clarifies. Senator Gansert.
Thank you. I think that's one of the things we needed to hear, but I do think we need some accountability along the way. Thank you.
Okay. Other discussion on the motion? Hearing none. All those in favor say aye. Aye. Any opposed?
Aye.
Any opposed say nay. Motion carries. Thank you. Okay, we're going to do 130, what did I just write down? 132 and 133. Yeah, I know you might. I know you might need a break right now, but we're going to keep going because it's getting late. It's 4:45, and we still have. We're only on D, so we're going to keep going. If you need to go to the restroom, just get up and go and go to the restroom. Not don't get up and go. Okay. All right. Yes, I'm going to stop. Okay. Right, and not all at once. So, yes. So. Give us as brief as you can, and then we'll get to our questions.
Thank you. Good afternoon, Chair and members of the committee. My name is Stephanie Woodard, and I'm the Department of Health and Human Services Senior Advisor on Behavioral Health. With me today is Ms. Lisa Sherrick, Administrator for the Division of Public and Behavioral Health, as well as representatives from the City of Las Vegas, Dr. Lisa Morris-Hibbler, Kathy Thomas-Gibson, and Randy Robison, who are present in person in Las Vegas in the Grant Sawyer Building. The work program request before you today is for $10 million in funding to rebuild and expand the Recuperative Care Center in the City of Las Vegas. Recuperative care is defined as a short-term care and case management provided to individuals recovering from acute illness and injury that generally does not necessitate hospitalization but would be exacerbated by their living conditions, meaning that if an individual still needs care and support to convalesce, however, they would be discharged to the street, a shelter, or other unsuitable places, their recovery could be complicated. So recuperative care really helps them provide to receive the support that they need in order to heal and go on to be able to be independent. So a little bit more, the estimated project costs are $17 million with annual operating costs of over $2.5 million. The city will utilize the entire $10 million from this work program to pay a general contractor to perform the construction work. Additionally, the city will contribute $7 million to the project costs and cover the $2.5 million in operating costs and ongoing costs. With the City of Las Vegas owning the Recuperative Care Center building, the State Public Works Division will not have any involvement in oversight and management. The City of Las Vegas will continue to oversee the existing federally funded capital project and will be responsible for ensuring all construction work is conducted in accordance with state and federal guidelines pertaining to ARPA funds. This is a one-time funding request with no future obligations to the state for additional investments. And Chair, we are all available for questions.
Okay, we have a couple questions. Senator Harris.
Thank you, Chair. My first question is for the City of Las Vegas, so hopefully the folks in Grant Sawyer are still awake. Has the city approved and secured funding for its $7 million portion of the project costs?
Mr. Chair, through you, for the record, Lisa Morris-Hibbler, Chief Community Services Officer for the City of Las Vegas. Yes, Senator Harris, those dollars have been secured.
Fantastic. And I think you answered this in your presentation, but we can never hear this enough. State will have no ongoing obligations?
That is correct. Stephanie Woodard for the record. Yes, that is correct.
Fantastic. Thank you.
Other questions? Oh, Senator Neal, sorry.
Thank you, Chair Dennis. So I just had a quick question. So I was reading the backup on this and how I guess folks would get to the respite center or the recuperative center, and so it mentioned the street medicine and outreach team, and I guess I'm wondering, like, mechanically, how exactly does that work in order for patients or clients, homeless clients, to get there that are having a medical or mental health episode? And I'm asking this question because, my district has part of City of Las Vegas, and I have seen very specific incidences where this is probably the moment to call the street team, but I've never understood how that works and how you trigger that for individuals that may be homeless.
Thank you, Kathy Thomas, Director for Neighborhood Services with the City of Las Vegas. Through you, Chair Dennis, to Senator Neal. The street medicine team is based in the urban core, the downtown of Las Vegas. And so they are mobile and rotating through the Corridor of Hope, which includes the Courtyard, Catholic Charities, Salvation Army, Rescue Mission, and the Shade Tree. So that general area is where the street medicine team is currently deployed. It's a 3-member team with a doctor and 2 EMTs. And so our ability to cover the entire city is limited by the size of the street medicine team. What we're doing is working with all of our partner agencies that are in the Corridor of Hope. When homeless individuals have been discharged to the street, to help our partners do an assessment of where that particular individual can or should go to get the best level of treatment.
Thank you for that response. Okay. Chair, can I ask okay. I'm definitely want to follow up with you guys offline because I reached out to DHHS to try to figure out how to trigger exactly this response, so I want to follow up because there is an incident that's right by Mount Moriah and MLK that I think it's inappropriate for that medicine team to be a part of because it is the same individuals that I keep seeing, and I keep wondering how this process is triggered for them to get care. So I'll follow up with you offline.
Thank you. If you could do that, that would be great. Any other questions? Assemblyman Carlton?
I would move for approval, Mr. Chairman.
We have a motion to approve, seconded by Senator Cannizzaro. Further discussion on the motion? All in favor say aye.
Aye.
Any opposed say nay. Motion carries. Thank you. All right. Okay, we're going to go to 134. Assemblyman Tolles, I believe you have a question. So we're just going to go straight to the question. Wait. Oh, I'm sorry. Oh, yes. Sorry. Okay, sorry. Let's do this is 134, right? Okay, so whoever's doing 134, if you'll come forward. Yeah, no, if you'll do just a brief if you'll do a brief presentation.
Good afternoon. For the record, I'm Stacy Montooth. I'm a citizen of the Walker River Paiute Nation, and I'm the Executive Director of the Nevada Indian Commission. My agency was created 57 years ago in statute to improve the quality of life of our 28 tribal nations and over 6,000 urban Indians who choose to make Nevada their home. Historically, essential services have been a critical need for our tribal communities, and this situation was exacerbated and magnified during the global COVID-19 pandemic. The state, specifically the Nevada Indian Commission, is respectfully requesting the allocation of $20 million of the American Rescue Plan state fiscal recovery funds to assist our tribal nations with such capacity in the forms of grants for our tribal nations to identify their specific needs. As a grant program to tribes, it respects sovereignty and self-determination, which empowers each of our tribal governments to identify their very individual, very specific areas of greatest needs. What questions may I answer?
Okay. So, Assemblyman Tolles.
Thank you so much, Chair, and thank you for bringing this forward. I was excited to see this on the list. I know that our tribal communities were particularly impacted in so many ways during the global pandemic, and then just also at going to the schools, visiting with families, understanding just the trauma oftentimes that our tribal communities experience. I'm thrilled that we have this grant available. Wondered if you could talk a little bit more about, and I know it's up to each tribe to decide how they will utilize that, but a little bit more of that process of how, what the benefits are, whether or not there is any direction that might be given around, child care or infrastructure or mental health services, health care, substance use. These are ongoing conversations that we've been having, and then also how we are going to measure the success of those outcomes. Thank you.
Bailey Bordelin for the record. So what you have before you is unique because there is only one work program, and that is really intentional because the process that we have been on with our tribal nations is that they were included in the state's listening tour. We know that they were extremely and particularly impacted by COVID and that they have great needs. At the same time, we have to recognize their comfort level with the state and their unique experiences. And so the plan here is that Director Montooth will work directly with the tribes if this is approved today. The committee will be saying, and the state and the legislature will be saying, we commit that this amount of money is here and you can trust it, and this will be used for our tribal nations, which will allow us to work together on developing the parameters of the grant. So we will work directly with our tribal nations to say, is it housing? Is it childcare? What sorts of things do you need? And that conversation is difficult because we do have to pair it up with the ARP rules that have come down, the 400 plus pages that Director Stevenson and I and our teams are now very familiar with, to make sure that we can find the best eligible ways to use the dollars to support their highest needs and support them in not making this a difficult, tenuous process for them to participate in so that they're not applying over and over again and being told, that's not eligible, think of something else, right? That it will really be a partnership in making sure that they can be successful with these dollars, but also self-directed for their highest needs. So if this is approved today, it is a vote of confidence that this money will be held in reserves for our tribes, and Director Montooth will work directly with the tribes, develop those boundaries, and come back with the accompanying work program before this committee to show you the work product that they did together.
Does that answer your question? Right. Okay, other questions? Do you want to do this or should we have Jill?
Mr. Chairman, I would move for approval.
Okay, we have a motion from Senator Carlton, second from Senator Cannizzaro. And that the motion is to put in reserve?
No, just to approve 134 as it.
Okay.
I mean, the work
Just to
program
approve
already
it.
puts it in reserve.
Okay, all right. It's already going into the reserve to the work program. So further discussion on the motion. Hearing none, all those in favor say aye.
Aye.
Any opposed say nay. Motion carries. Okay, we will now go to 139, 140. We have a couple members had questions. Senator Gansert, we'll start with you.
Thank you, Mr. Chair. So in looking at this, it reminds me of some of the work that Christy McGill from Safe and Respectful Learning was talking about earlier. And so part of my question is
okay, hold on one second.
Oh.
Okay, go ahead.
Thank you again, Mr. Chair. So when I look at this, it looks like it's intended for 1st through 12th graders, and Safe and Respectful Learning within the Department of Ed does quite a bit of work on this front, and they talked about tiered services, and this talks about family counseling. So, so first, I guess I want to know if you're coordinating with them, because it looks like you want to do a private contract, but I know that they may have some of those resources too, and if there's any coordination between the Department of Ed and specifically Safe and Respectful Learning.
Hi, thank you for the question. For the record, Cindy Pitlock. So this particular program is actually targeting after-school programs that are in the space of this, such as Boys and Girls Club. There are several types of programs that are in the space of providing services where youth and families access a great touch point. So is there coordination specifically to make sure there's not a duplication of services? Is that the question that you're asking?
Or aligning the services, so not necessarily duplication, but that you're aligned with what they're doing within the schools.
Sure. So Stephanie Woodard, for the record, we work really closely with the Department of Education, and certainly this can help to build off of the work that you heard about earlier today around multi-tiered services and supports within schools. This would actually provide some additional funding to the community programs that would help to continue to accentuate some of the work that's happening in the schools. So absolute alignment, just ensuring that we have adequate access, or we're building towards adequate access to some of those additional services in the community for students and families.
Thank you. And then also, I appreciate that you're going to integrate graduate and undergraduate students, because I think we need to be working on our pipeline. And when you start touching the undergraduates, that will really help improve access, I think, in the long run, because some of those will become graduate students and so forth. So thank you.
Okay. I believe Senator Hafen might have had a question on this. Is that? Nope. Okay. Any other questions? Not hearing any. Senator Gansert, you want to make a motion?
Thank you. I'd make a motion to approve D139 and 140.
We have a motion from Senator Gansert, second from Senator Assemblywoman Carlton. I want to say Senator. She was my state senator first. So we have a motion and a second. Any discussion on the motion? All right. Hearing none, all those in favor say aye.
Aye.
Any opposed say nay. Motion carries. Thank you. Okay, we finished D. Now we're going to E. And I believe, what are we? E5 with E21. Okay, we're going to do E5 and E21.
Chair, if I may.
Yes, I can hear you.
Thank you. Jessica Adair-Brennick. For the record, good to see everyone again.
In November of 2019, AG Ford announced a settlement regarding the merger between T-Mobile and Sprint. As part of that settlement, T-Mobile committed to keeping hundreds of Nevada jobs, deploying a high-speed 5G network covering most rural communities, and offering low-price plans. T-Mobile also committed to paying $30 million to be used for enhancing telecom service to tribal communities and investing in opportunities for minorities, women, and small businesses. The program before you today, developed by GoEd, is a win-win-win-win. This program will use $4 million of that T-Mobile settlement funding to offer a paid internship program for Nevada college students who are women and people of color pursuing STEM education and working at Nevada tech companies. It's a win for students who will gain on-the-job experience in the tech industry while being paid for their labor. It's a win for a growing industry that's critical to the expansion and diversification of Nevada's economy, but new companies frequently cite a lack of talent in engineering and computer science as an obstacle for their further growth. And I think you may have heard from them, some of them this morning in public comment. It's a win for Nevada's universities to offer internships for their students and enrich their experience. And it's a win for Nevada as the state seeks to grow our economy and retain talented young Nevadans who may otherwise seek to go to another state for job opportunities in tech. And if I may, Chair, I would like to turn it over to Karsten Hayes, Senior Director of Strategic Programs and Innovation at GoEd. And Karsten has been an incredible partner to our office and an absolute pleasure to work with on these programs. And I cannot thank him enough for his work on this. Thank you.
Yes, go ahead. And
Mr. Chairman and members of the committee.
is the word.
This is Carsten Heiss for the record, Mr. Chairman and Madam Vice Chair, members of the committee. I've seen my boss, Dr. Michael Brown, behind me, and I would like to give the opportunity for him to go first.
Okay.
Thank you, Mr. Chairman, members of the committee. You heard Sasha Stevenson testify a long time ago about this program. We got approached by the startup committee, venture capital community about setting up a subcommittee of the board. The governor had 2 roundtables with this sector, and this is an emerging sector in our Nevada economy. We rank of the 50 states, 18th in this space, with Arizona right ahead of us at 17th. We have been taking recommendations from this community, and one of the recommendations they brought forward was creating this kind of an internship program. We reached out to the Attorney General's office, who found it of interest, and Karsten would be pleased now to walk through the particulars. Thank you.
Thank you. Okay, go ahead.
Thank you. Carsten Heiser for the record. And in the interest of time, it's late. Just let me highlight a couple of really important main points. But still would like to introduce you to part of the team. Michelle Lin here from GoEd, my colleague, Katja Albright from UNR, who is a partner in this effort, and I believe online, I can see him sort of up there in the back, Mr. Zach Miles from UNLV, who's currently, I believe, traveling up north. So this is the team, and you heard from other team members this morning in public record. Professor Jiang Jingtao testified in Las Vegas, and also Mr. Doug Irwin from EDORN called in for public comments, so did representatives from Starboard NV and the city of Las Vegas. So you may ask yourself, why is this important? Because we have so many other internship programs already operating in the state. So how is this really different? And well, the first answer or the first response to this is really we cannot have enough, because the competition for talent is real. That's internationally, that's nationally. And if you look at the competition for engineering and science, where this program really concentrates on, it's even realer, if that's a real word, but it isn't. And especially there in women and minority, they are clearly underrepresented in the science and the engineering fields, and we have data to prove that. And as Dr. Brown already alluded to, we have gone through a tremendous growth in the to urban ecosystems, startups in ecosystems in Las Vegas and in Reno over the years, so we have to catch up with this. So we're trying to basically prevent the brain drain, and we are trying to create a really meaningful and targeted and effective program where we're actually paying $18 an hour. So more than what would otherwise or what has materialized in the past. And another aspect of that shouldn't be forgotten. Nevada is home to a large number of first-generation college students, and they often come from the same demographic. And as you probably can imagine, those first-generation college students are more risk-averse naturally. So they will not end up necessarily being founders. What we hope to achieve, founders are meaning founders of startups, and what we are hoping to achieve through this program is sort of a medium-term effect, which we could call a deferred founder effect. If we place those individuals with startups and with technology companies, that over time, once they find more confidence and establish themselves, they can then become founders. So they will become founders, but not immediately, but sort of deferred. And another aspect, if you go to our sister agency, Office of Workforce Innovation, and you look up the top 20 or more high-demand occupations, you will find 6 of the top 10 spots exactly in this area that we are targeting. So the need is there. So how is this different? So the standard models for internships, they utilize job boards, job fairs, traditional means of outreach. This is different because we are going to embed those programs deeply into the local technology ecosystems. The programs perform really an active role and will be acting more as a catalyst for leading to mutual beneficial collaboration between the university and the startup community and the community, including obviously technology-based firms. And that really narrows the gap between the university and high-growth employers. And through that, you also get a feedback loop back to the university. So the feedback goes back and say, okay, what are we teaching? Is this actually relevant for our high-tech employers? We believe we have presented a sort of compelling case for this program, and we therefore commend it to our proposal to the committee.
Okay, questions? Senator Carlton.
Thank you very much, Mr. Chairman. Just a couple quick questions. So as these internships evolve, you glanced upon it very briefly. Where are we going to find these students? Because I see the money is aimed towards a certain demographic, and we want to make sure that demographic is hit. So I want to understand the plan for that. And then also, we know that there's going to be an ongoing need. These dollars are only going to go too far. I'm assuming there's going to be an evaluation afterwards. And then is there an ongoing plan to request more dollars when these dollars are exhausted? Or are we going to evaluate it first and then see if there's other funding out there? So those two very briefly, and then I have one for the university.
Thank you, Madam Vice Chair. Carsten Heiser for the record. Yes, the agreement between Telecom Sprint and the state of Nevada restricts those funds to be spent only for these demographics. So we cannot go and recruit other students under this program. So it has to be minority and or women students in these. But where we are sort of discriminating this in the positive sense, where we're saying, from what educational background, it will be from engineering and science. But it has to be these demographics. So the answer is clearly yes. We can't, under the mandate of the grant, go for other demographics. We are cognizant of that this is finite. We stretched it to 3 years, which I think is ambitious, but I think we can get more than 300 students per program, i.e. and UNR and at UNLV over the 3 years. And But we are aware that this needs to be sustainable. So what GOED has done is we submitted a bill draft request for the forthcoming session, where we are trying to enshrine a internship program like this in legislation. There's no fiscal note attached to it, so there's no funding. But we believe that over the 3 years, we will show, to your point, your valid point of an assessment of how well this program is going, that we will use these 3 years to secure more funding. And that funding actually, I'm hoping, although hope should never be a strategy, but in this case it could be, to demonstrate this to the private sector, because they're benefiting from this. That they will contribute to make this program more sustainable. But we're trying to enshrine in legislation, no funding attached to it. But I think 3-year runway will give us ample time to identify other funding sources.
Thank you. So for clarification purposes, these will already be students at UNLV who will be receiving these internships. You're not going out to high schools or community. So this is not open to community college students. This is only open to UNLV, UNR students.
Carsten, for the record, that is correct, Madam Chair.
Okay.
Vice Chair.
So this is really in the weeds, and I apologize, Mr. Chairman, but these internships, will they be credited hours? But they're being paid, so I'm not sure if you can give them credit hours at the same time as you're paying them.
Katia Albright from the University of Nevada, Reno, for the record. So the model for this internship program is based on a model that we use at the University of Nevada, Reno. It's called the PAC Internship Grant Program, and this program is flexible. So if a student wants to receive internship credits, they can take a class in addition to that, but it's not a requirement. Part of this is a talent retention idea to keep highly skilled students in workforce, and that's why it's primarily for UNR, UNLV. I understand there's other internship programs for the community colleges, so this one is specifically aimed at that. Not sure if I answered your question.
Yes, you did, and I'm disappointed that community college students won't have an opportunity to do this, but I understand you're trying to work from a certain base. My concern is that it's going to impact weighted student credit hours in the future, and there will be an ongoing cost. But that's really deep in the weeds for right now. That's for whoever chairs higher ed next session. Put that on your list to make sure that this does not impact your weighted student credit hours, because that is your ongoing wrap-up costs on this. So thank you very much, Mr. Chairman.
Okay, other
Vice
discussion?
Chair, if I may address your concern about community colleges.
Yes, go ahead.
Thank you for that question. That is exactly something that we discussed with GOED, community colleges, as well as Nevada State College. We decided to limit it to UNR and UNLV because they already had this existing infrastructure. And because of that, we were able to use more of the funding for the students rather than standing up a new program within the colleges. That being said, we're very interested in continuing to work with GOED and potentially partnerships with the private sector to grow this program to other educational institutions in Nevada to give every Nevada student this opportunity.
Thank you. Senator Harris.
Thank you so much, Chair Dennis. Not so much questions, but just a couple of comments. And I know this was just discussed, but we have another 4-year institution in this state that I think would also like to be part of this program as it expands. And then the other thing I wanted to just quickly note is you mentioned you will have a BDR coming during the next session. I'm hoping you will consider expanding it, not just women and minorities, but women LGBTQ and minorities as well. That's something that I worked on last session with these types of programs, and I'm hoping we can just continually expand that. So if that bill isn't drafted yet, I'd love to see it. Thanks.
Okay, other questions?
Chair Dennis?
Yes. Who is that? Senator Neal. Go ahead.
Thanks, Chair Dennis. So I had a question on the, I guess, how it works in Southern Nevada. So in the backup, it's saying that the engineering school, I guess, will partner with Startup Vegas. And so I guess I'm trying to understand how that works. I'm familiar with Startup Vegas, but it's more like an entrepreneur ecosystem, makerspace kind of. So I'm trying to figure out how many of the STEM businesses are in Startup Vegas in order to make this talent retention or STEM talent retention piece work in Southern Nevada.
Go ahead.
Thank you for the question, Carsten Heiser, for the record. Zach, do you want to take that? Otherwise, I can.
Yeah, certainly. Yeah, certainly. So Zach Miles for the record. I think they're one of the partners that we'll utilize to be able to proactively seek engagements with high-tech companies. So it's one that's been identified, but it's not an exclusive type of a relationship. And so kind of as mentioned before with Karsten, kind of that reactive situation that we're in, the funding really helps us and the high-tech companies to proactively seek each other out and build the program. So I guess in its simplest form, they're one collaborator, but they're not the sole collaborator.
Okay, thank you for that clarification, because in the backup, it says the Southern Nevada Internship Program will be led by UNLV's College of Engineering in collaboration with Startup Vegas, and it doesn't mention any other entity. So that's why I was asking. Thanks, Chair.
Thank you. Other questions? Someone, Carlton?
Okay, Mr. Chairman, with about 75% enthusiasm, I would move for approval of this item. You can't have everything, so.
Well, this time of the afternoon, I think 75% is really good. So, all right, we have a motion and a second from Senator Catanzaro. Further discussion on the motion? Hearing none, all in favor say aye. Any opposed say nay. Motion carries. All right. We will now go to, let's see, that was, we need to go to 17, E17. No, we're just doing 17. We have to separate them because they're conflict. And I believe Senator Goicoechea has a...
Thank you, Mr. Chair, and I'll be extremely brief, given an hour. I don't know who, I guess Mr. Ferris from the Department of Ag. I know this is federal money, the $500,000. The data in the document says you're going to continue your programs and some of the right-of-way fencing. I'm just concerned, 5,000 animals in there. We continue to tighten the perimeter. At some point, you're going to have to buy hay. Any comments?
For the record, Doug Ferris with Nevada Department of Agriculture. I don't know. I hope we don't end up at that point, Senator, that we need to buy hay.
Well, you don't need a degree in nutrition to know that 5,000 animals in that confined space isn't going to work. So I was just curious if there was any additional plans other than just continue to fence and continue the existing program.
For the record, Doug Ferris. Currently with this, Senator, that is our the outlook on this with this program is just to increase by one staffing manager, and then also for continued fencing in protecting public safety.
Okay, I thank you. I missed the one staff member. Thank you. Thank you, Mr. Chair.
Right.
I make a motion to approve.
Let me just make sure. Any other questions? Okay, then I will take that motion. Senator Goicoechea, second from Assemblywoman Carlton. Any further discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Any opposed say nay. Motion carries. All right, I think we are now on East 18.
Again, I asked for this to be pulled, Mr. Chair, because the contracted state veterinarian is an immediate family member of mine. I need to abstain.
Okay. Do we have any discussion on the, or any questions on the item? Then I'll ask Assemblywoman
Move for
Carlton.
approval, Mr. Chairman.
We have a motion to approve from Assemblywoman Carlton, second from Senator Cannizzaro. Further discussion on the motion? Okay, all those in favor say aye. Aye. Any opposed say nay. And we have one abstention with Senator Gokichia. Motion passes. All right. Are we on now E23? We're on E23. I believe this is one that Senator Neal wanted to pull.
Yes, thank you, Chair. When I read it, I thought it was related to D134 and the question that I was going to have about the lodging tax, the $5 million, if any portion of that was going to go to the tribes. That was my question about it.
For the record, Brenda Scolari, Director of Tourism and Cultural Affairs. Senator Neal, the mention of the Division of Tourism in the item, the work program related to 134 is in error. So I think it was called out due to a mistake. But no, the work program in item number 23 is simply to adjust our lodging tax projections and our lodging tax authority. When we build our budget, when we did so 2 years ago, it was based on projections, as we all know, in a very volatile time related to room nights. So we're making that adjustment now to collect our 0.3% of lodging tax that's in statute. So that represents the 5.7 million in the work program. The work program in 134 is solely for to create the tribal grant program.
Okay, thank you for that clarification, and thank you, Chair Dennis.
Okay, do you want to make a motion? Well, any questions? I'm not hearing any, so if you want to make a motion, that's fine.
I make a motion to approve E23.
Okay, we have a motion from Senator Neal to approve, second from from Assemblywoman Carlton. Further discussion on the motion? Hearing none, all those in favor say aye. Any opposed?
Aye.
Any opposed say nay. Motion carries. I believe that finishes E. Okay, we are now going to move. Let's see, where are we at? We're going to item F on the agenda, statement of is that right? A statement of contingency account balance. Mr. Thorley.
Thank you, Mr. Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. The statement of contingency account balance can be found in volume 4 of the meeting packet under tab F, which is page 7 of volume 4. I'll be very brief, starting with the summary sheet on page 7. Prior to any actions of the committee today, the total balance in the contingency account made up of the unrestricted general fund, unrestricted highway fund, and the restricted general and highway fund is just over $22 million. Originally, there were 3 requests before the committee today for allocations from the contingency account. However, one of those requests has been withdrawn. It is agenda item G1A, a request for allocation of $17,237 to fund additional costs on the South Fork Dam. That withdrawal request was received yesterday, and that was after the agenda was posted, so it's not reflected on the agenda, and it's also not reflected in this statement since the statement was prepared before then. So the total amount of requests, the $572,432, is actually reduced by a little over $17,000. So the total amount of requests for the committee is actually $555,195. And if all the items, the remaining 2 items or I should say remaining 2 requests for allocations from the contingency account are approved, there will be $21,481,106.90 in the IFC contingency account. Happy to answer any questions that any committee members might have regarding the statement.
Questions? Not hearing any. Informational only, so okay, so we can move on to item H, requests for approval to accept gifts and grants. Or G, sorry, did I miss it? Oh, sorry, request for allocation from the IFC contingency account, item G. And G1A has been withdrawn. So what do we have? I don't have that. Okay, so we are on G1B. Request for an allocation of $250,000 to restore funds to the account for the channel clearance, maintenance, restoration, surveying, and monumenting program. And that is Adam Sullivan, State Engineer, Division of Water Resources, or designated person.
Good evening, Micheline Fairbank, Deputy Administrator with the Division of Water Resources. So this request is seeking the funding to the contingency account for channel clearance is statutorily authorized. We have an application. We don't have sufficient funding, and when we don't have sufficient funding, we come before the committee here and seek that funding as provided under the law. Happy to answer any questions.
Questions? Not hearing any. We have a motion from Assemblyman Carlton, second from Senator Canizaro. Further discussion on the motion? Hearing none. All those in favor say aye.
Aye. Aye.
Any opposed say nay. Motion carries. All right, and we have now, is it item 2G? Yeah. I'm sorry, yeah, G2. David Fulkerson, Administrator, Office of the Military, or designated person.
Good evening, Chair and Commissioner. Excuse me, I apologize. I'm in the East Coast meet with FEMA this week with some staff members, so I'm standing outside to get away from the noise. We come to you asking for funding from a request from Las Vegas Metropolitan Police Department, along with the Department of Emergency Management, and then also the Office of the Military, to ensure that we have force multipliers using the Nevada National Guard and Office of Military employees for their support during the New Year's Eve event. You're going to staff Southern Nevada along with some spare resources in the north in the event anything does occur to protect the economy and our tourism industry within Nevada. Open for any questions.
Yeah. Okay, thank you. Do we have any questions? Yeah, Senator Carlton.
Thank you very much, Mr. Chairman, and I'll make this brief. In the statement that we have in the book, in the second paragraph, it states this should be the last request from the division for this funding through the Interim Finance Committee. The Governor's Office has indicated that this funding will be included in the Governor's recommended budget the next session for the Nevada National Guard. Thank you very much. We've wanted this fixed for a while. I look forward to it being in the budget. Thank you.
It's one of those things where we know it happens every year, and yet we're coming in for contingency, so it's good to get in that budget. Thank you. Other questions or comments? All right, hearing none. We have a motion from Senator Carlton, second from Senator Canizaro. Further discussion on the motion? All those in favor say aye. Aye.
Aye.
Any opposed, say nay. Motion, hearing none, motion carries. Okay. So. Okay, so we are now on H. Anyone have any question on any of these? H1 was withdrawn. Yeah, Silverman Titus.
Thank you. My question was one on H3C, and I was just wondering, that this was for monies for
C1 or 2?
HC1.
Okay.
And I just need some clarification. This is funding for drinking water facilities. Is it these people that bottling water, or are these water treatment plants, water purification plants? I just wanted a clarification.
That would be the Division of Environmental Protection. Do we have any?
Mr. Chairman, this is Jason Cooper from the Division of Environmental Protection, Office of Financial Assistance. I'm the program manager for the Drinking Water State Revolving Fund and the Clean Water State Revolving Fund. Item H3C1 is our normal grant appropriation for the Drinking Water State Revolving Fund that will just provide additional loan funding to water systems across the state. It is meant for capital improvements only.
Excellent. Thank you for the clarification. Thank you, Mr. Chair.
Mr. Chairman, I would move for approval of all items under letter H.
With item 1 withdrawn.
Oh, with item 1 being withdrawn. Thank you.
Thank you. We have a motion and a second from Senator Cannizzaro. Further discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Any opposed, say nay. Motion, hearing none, motion carries. All right, we go to item number I. Was withdrawn. J, we've done. K, informational items. We've got one left.
We've got 5. Yeah, 5 was pulled by Senator Seaver's cancer.
Okay, we have K5, Senator Seaver's cancer.
Thank you, Mr. Chair. So I was looking at the WICHE slots and the changes in the WICHE slots, and I was concerned, and I know this is for informational item, it is an informational item, but we know we need behavioral health and psychiatric health, and when you look at the health professional education program, the HPEP, there's been reductions, more than half for the Master's of Social Work program. It's a 2-year program. We've gone from 12 to 5. And then when you look at psychiatric nursing, we've gone from 20 to 11. And when we go to geriatric training, it's 10 to 5. And so anyway, I understand that it says it's because the repayment, it looks like it's because the repayment program has not received the revenues that it anticipated. But it's just concerning because this is something that we may want to consider shoring up at some point in time because these professionals are critical to our workforce in Nevada. Thank you.
For the record, my name is Patty Avila Porter. I am the director of the Nevada Office of WICHE, and regarding the issues about the slot matrix, which really is a part of the budget process, that funds are allocated in a slot matrix, which breaks down the number of awards available by occupation area. I'm here today to notify you of the adjustments. And in regard to the FY22 slot changes, the decrease for that number was due to the difficulty of outreach during the pandemic, and also the office was moved during the pandemic from the governor's office to the Nevada System of Higher Education office in Reno. Also, our agency is an agency of 2. So, and we had a vacancy, so it's an agency of 1 during the pandemic, and the director left at the end of last year. I was appointed recently in May of 2022. So just to let you know about that, as far as FY22 changes and the decreases, a lot of that has to do to the declining loan revenue. The stipends that we give out are based on from our base budget, and also the loan revenue repayment we receive. And so there's been a decline in that. And so the numbers had to be reduced due to the projections decreasing. And then to note, the last legislative session in the 81st session eliminated the loan component, which was for good reason, because we were having a hard time attracting candidates for our program. But I hope that answered your question.
It wasn't really a question. I just thought we needed to take note of this because we went from 42 to 8 and this HPEP, and then 42 to 21 over a couple of years.
Sure.
And so I don't know if we need to change how we recruit people. And then it's like the loan repayment. Do you think there was confusion around the federal loans, that student loans, and maybe they thought they didn't have to pay them back? Or do you know what happened with the decline in revenues?
Well, I think for good reason why. The rationale behind eliminating the loan component was that there were a lot of candidates that didn't really want to get into a situation of having to owe funds. Also, in some analysis that I've done since being in my position since May, really there was a bad debt charge-off of over $790,000 in 2021, which obviously takes that out of the pool of repayment. So to address that issue, as far as recruitment, I am very excited to get involved and have outreach to all the universities. And from even though my numbers have been slashed for FY23, I'm already got most of them filled as far as my outreach on that. And then and I'm someone that likes to grow and get involved and get it larger. I do want to make note, though, for correction, that in the handout that I provided you from our office, I wanted to make a correction on the slot numbers for FY23. I indicated 11 for advanced practice nursing, which is the FNP, APRN, DNP, and psychiatric nursing. I had indicated 11, but actually that number is 18. So I just wanted to make that correction for the record as well.
Thank you.
Okay, thank you very much. So all these items on K are informational, so we don't need to take a vote. We will now move to public comment. Wait, what's K? K8B2. Oh, sorry, K8B2. Why do I? Hello, go ahead.
Good evening, Melissa Lawfer-Lewis for the record. So this informational item is our Q4 report on the Disproportionate Share Hospital Program. Happy to answer any questions you may have.
Okay. Simon Carlton.
Thank you very much. And DISH is kind of a heavy issue to get into at 5:45 in the evening, so I'll try to make this as easy as possible. So with the changes in the federal rate and the response from the county, how is the Clark County's decision to pay a lesser amount in the intergovernmental transfer fees, how is that going to impact the state net benefit?
Thank you for the question, Melissa Lawfer-Lewis for the record. So I think we all understand that the DISH program was created pre-ACA when uncompensated care was greater. Given where we are currently with Clark County, we understand that the DISH program is going to need some revisions. However, this program does affect other hospitals outside of UMC. So the division has been collaborating with UMC to find a solution to ensure that the state net benefit is maintained either through this program or changes to other current supplemental payment programs. So it is our intent to find a common ground solution, but we are not quite there yet.
And thank you very much. I remember we called them the DISH wars way back when, between a number of well-known hospitals. UMC is the only public-owned safety net hospital in the state, so we want to make sure that they're the hospital of last resort for our constituents. But yet if the county doesn't negotiate and that rate ends up changing, it'll have impacts The domino effect will be across the state. So I'm glad that you're still in negotiations. Thank you for the answer. I just want to make sure that UMC gets the dollars that they need in order to be able to keep serving the folks that come through the door. Thank you very much.
Okay, any other discussion? Okay, thank you very much. All right, so now we will go to public comment. This is the last period public comment on the agenda today. And just mention it again, because of time considerations, we've had all day. We're limited to not more than 2 minutes. So anyone here wishing to give public comment, come forward here in Carson City. Don't all rush. Take your time. All right. Nobody here. How about in Las Vegas? Anybody wishing to give public comment?
I don't think so, Mr. Chair.
Okay. Nobody there. Let's go. BPS, is there anyone online wishing to give public comment?
Thank you, Chair Dennis. To provide public comment, please press *9 now to take your place in the queue.
Good evening, Chair Dennis and members of the committee. My name is Alexandria Canito. That's AlexandriaCanito, with Louis Roca, calling in on behalf of Washoe County. Washoe County is in support of items D130 and D131 on today's agenda, which adds much-needed forensic bed capacity in southern Nevada. We are currently seeing the majority of the Lakes Crossing facility beds utilized by court-ordered individuals from southern Nevada, and the facility is not even remotely able to handle the needed volume. And the addition of beds in southern Nevada greatly improves the capacity and keeps individuals in their communities closer to family and resources. Thank you.
Thank you. Let's go to the next caller.
Thank you, Chair. Once again, to provide public comment, please press *9 now to take your place in the queue.
Good evening, Chair Dennis and Vice Chair Carlton. This is Dora Martinez, DORA, MRJ, and ESV, and the rest of the committee. I cannot see, but I will miss you guys' sexy voices. I call it as I hear them, and I appreciate all of you guys, especially my rock and roll superstar, Assemblywoman Benitez Thompson. We thank you, and we appreciate all that you do. God bless you all. Take care. Have a great evening.
Thank you. I got that wrong all day. It was rock and roll superstar, not super rock and roll star. Thanks. Okay, great. Thank you very much. Anyone else wish? Do we have anyone else on the line?
Thank you, Chair. The public line is open and working. However, we have no additional public comment callers at this time.
Okay, thank you. Before we adjourn, I just wanted to take the opportunity to thank all the members who have served, and Vice Chair Carlton, and that have served and won't be coming back. So this is their last meeting. Myself, Vice Chair Carlton, Senator Tatro, Assemblywoman Benitez Thompson, Assemblyman Levitt, Assemblyman Roberts, Assemblywoman Tolles. Thank you so much for your service. If you wish to make any comments, you're welcome to. Anybody? Assemblywoman Tolles.
I know that people are trying to catch planes, so I'll keep this short. But I do want to just end on a note of gratitude. It was 13 and a half years ago or so that I first gave public comment as a parent in this room. And I remember Assemblywoman Benitez Thompson sitting right here in this seat. And I remember making note that she listened and that she was very attentive. And I just want to thank you for your service and for your friendship. And I also want to thank Vice Chair Carlton for just an epic journey of serving in both houses in this building, and to Chair Dennis for your friendship also, and your leadership, and for being a leader who listens. And I just want to thank all the staff and my colleagues for so many good times and some not so good times, but unbelievable memories. And I'm just so truly grateful for the 3 terms. I'm grateful for some time to focus on some other things, but I leave here with tremendous gratitude and appreciate you all.
Thank you. Anyone else? Senator Canizaro.
Realistically, I just want to keep you all here with me a little bit longer. No, I want to say a special thank you to everyone who has served with us, even for short periods of time, and who are leaving us to go do other things. But just a very heartfelt and special thank you to Assemblywoman Benitez Thompson, Assemblywoman Carlton, and Chair Dennis. I will treasure our friendship forever, and will miss you immensely in the Senate. And honestly, Assemblywoman Carlton, I'm not really sure how we're going to run this committee without you. So thank you very much for all of your service.
Thank you. Senator Tatro.
No, I just want to thank everyone, staff, and everyone on the committee. It truly has been the honor of a lifetime, and I appreciate everyone's kindness and professionalism, and it's been a great time. So thank you very much.
Okay.
I just want to thank you all, but mostly my husband. Mostly my husband and my 2 daughters for this incredible 24 years. The state's in great hands. You'll do a good job. Yeah. And I'm very thankful for staff. We work up here and we get it done, but we look really great because they're behind the scenes doing everything. So we could never do it without them. So I want to thank them very, very much. My husband joked when I first got elected, they gave the state checkbook to a woman who doesn't balance her own checkbook because I was a waitress living off of cash. So without the staff, we would have, we never would have made it. But I wish you all very, very well, and take care of yourselves, because you can't do a good job for your constituents if you don't take care of yourselves. So thank you all.
Thank you. Senator Neal, did you have a comment?
Yeah, thank you, Chair, for the privilege to say something. So to Assemblywoman Benitez Thompson, because we came in together in 2011, thank you for your friendship. Assemblywoman Carlton, for your mentorship. It has been an amazing, it's been 12 years for me too, with you guys. And Chair Dennis, thank you as well. I mean, I know I'm a pretty tough character to take, but you guys have really helped me to understand Medicaid and how to review a budget. And so it's been very, very helpful having you guys in my life and mentoring me. So I know I'm going to call you guys a lot, but thank you for just being my friend.
Thank you. 18 years ago, I walked into my first IFC meeting as a brand new freshman in the legislature, and as was typical back then, Bill Raggio asked for $20 for lunch, and I was I said sure, and he actually apparently he never gave it back to most people, but to me he actually paid me back. So anyways, I have appreciated serving on, I think there's only 2 years out of my 18 that I haven't been on either Ways and Means or Finance, and I think I've only missed like 3 meetings in that time. We've done a lot of good things for the state, and we've got a lot of great people that have served. And as was already mentioned, we have an amazing staff. Without them, really, I don't know how we would do this. They make us look good, and they help us to learn. And so it's been a privilege serving, and all of those that are not coming back, I consider you all friends, appreciate the service that you've given, and thank you. Grateful to serve with Maggie. I mentioned she was my senator. The first time I met her, I was in my front yard, and she and her daughter came up and asked for my vote. And that was, it was 24 years ago. And never knew that, we would serve together. And, I always thought when I got elected, I would be here for like 4 years, change the world for 4 years, and I'd be done. But grateful to my wife and my family for the support that they've given, and so that I could do this. And so thank you all for your service. Thank you for being here today. We have no further items to come before us today. Oh, and also thanks for putting up with me as chair for the last couple months. When Senator Canizaro asked me she said, "Oh, we're going to have a couple meetings between now and we've had like 8 meetings or 10 or whatever." Yeah, right. Yeah. So, but I've been on this long enough that I knew that wasn't going to happen. So with that, thank you very much. And everyone, please travel home safely. With that, we are adjourned.